नमस्कार, आप सभी का हार्दिक स्वागत है. We would like to welcome you all on behalf of Independent Research Ethics and particularly the journey of sharing, journey of inspiration and journey of excellence. Thank you very much for your overwhelming response from last 3 years, 2 months. This journey started before 3 years and 2 months, and now we have been able to touch the milestone of 1012 today. We have recently completed our celebration 1012. Now I would like to welcome Professor Vishnu Prasad Sharma ji for his welcome address, but the slight change is there. Today we are fortunate enough that Dr. Kirti is with us and Agnihotri ji is with us. So the secret of Agnihotri ji means by how we start this celebration with Agnihotra. Dr. Kirti will explain, and by that we will be considering inauguration. But Kirti ji, 1 minute. Kirti ji, 1 minute. Kirti ji, 1 minute. But before that, I would like to request Professor Vishnu Prasad Sharma ji to welcome all the expert speakers. After welcome,
Namaskar, good evening, respected distinguished guests, eminent speaker, ladies and gentlemen. I, Professor Sharma, welcome all of you to this evening webinar on mental health best care by IRES. Most important subject today we have. In this webinar, we have eminent guest speaker. I want to welcome Dr. Subhash Shetty from Belagavi. Namaskar, sir, and welcome you to this evening webinar. Dr. T. Kartikeyan from Chennai. Namaskar, sir, and welcome you to this evening webinar. Next, Buddha Dhananjay Patel from Jamnagar. Namaskar, sir, and welcome you to this evening webinar. Dr. Shyam S. Sharma from Mumbai. Namaskar, sir, and welcome you to this evening webinar. Next, I want to welcome Dr. Niranjan S. Asaria. Farooqabad. Namaskar, sir, and welcome you to this evening webinar. Next, I want to welcome Dr. Nishan Shulka Anandpal. Namaskar, sir, and welcome you to this evening webinar. Mrs. Sudapa Pardhan from Kolkata. Namaskar, madam, and welcome you to this evening webinar. Dr. Leena Gehani from Bhopal. Namaskar, madam, and welcome you to this evening webinar. Dr. Mahendra Ali, Akalpur. Namaskar, madam, and welcome you to this evening webinar. Once again, I welcome all the eminent guest speakers to this evening webinar on mental health best care by IRES. Namaskar, and over to Pavanji. Thank you.
thank you very much, sir. I would like to introduce Dr. Kirti. Dr. Kirti is MD Ayurveda and she is expert in certified trainer of Agnihotra. And she is training means treating mental health disorders by Agnihotra. So this mental health session is fortunate enough to have Kirti. In my opinion, she is also Agnihotri when she is performing Agnihotra by not by surname but by karma. She is Agnihotri. So I would like to welcome Dr. Kirti for her Agnihotra. It will take approximately 1 to 1.5 minutes. So please be spiritual, be focused on our Almighty, whoever the Ishta may be. Welcome, Kirti ji. Please inaugurate the session by Agnihotra. Please unmute yourself. Unmute. You are mute. आप म्यूट हैं. अनम्यूट कीजिए, अनम्यूट कीजिए।
Okay.
Yes.
Am I audible now?
Yes, yes.
Thank you. I will be starting with the Vyaruti Homa. We will be seeing the process of Agnihotra after some time. But just sir has given the opportunity to start the session with the Vyaruti Homa. It will just take hardly a minute. Many of you know the procedure of Agnihotra. Recently, I had been fortunate enough to visit Belgavi KLE College. Swa Shetty sir had given the opportunity. I had been a guest speaker in their Garbha Samskara thing, represented Shri Ayurveda College where I am currently working now. So Agnihotra has many benefits, but we'll just start with the Homa first. I think all of you can see this, sir. How I have arranged the cow dung cake.
Sure,
Yes,
sure.
madam, we can see. Yes, madam.
Sir,
We are able to see. Don't worry.
yes. So this is just the, I have arranged the cow dung cakes and we'll be performing a small Vyaruti Homa. Just to start the session, or we can say inaugurate the session in the Vedic way. I'm just giving the offerings with ghee only. Bhu Swaha Agnaye Idam Namama. Bhu Swaha Vayave Idam Namama. Swaha Suryaya Idam Namama. Bhur Swaha Prajapataye Idam Namama. Thank you. Done.
Thank you. Thank you. Now this platform is also spiritually purified, we can say. Thank you. Thank you very much. Now I would like to please explain the effect of Agnihotra on mental disorder in your session when your turn comes.
Ji sir, ji.
Thank you. Thank you, Kirti. So now I would like to request Agnihotri sir for brief preamble.
Thank you, Professor Pawan Sharma ji. Welcome to all the guest speakers of today's webinar. नमस्कार सभी को. बड़ा अच्छा लगा आज के हमारे इस इनॉग्रल स्टार्टिंग में अग्निहोत्र कर्म प्रत्यक्षता डेमोन्स्ट्रेट करके आज के इस इवनिंग सेशन की शुरुआत की गई. It's a great pleasure and we are fortunate enough to have this oblation or the cow dung cake with the chanting of mantras by Dr. Kirti. Definitely it itself creates not only an environment but also creates an aura. Whosoever is sitting in front of this program, persons, those who are there, they are inhaling all these fumes of after burning the oblations, offering oblations and burning of all these things. So she will narrate in a details because it's our traditional this thing, and we are carrying this distinction with our name as Agnihotri, a person in whose family this karma is taking place daily, and we suppose at the town and in that way. So that is entirely different to our concept is, our approach is that how it happens better for the mental disorders person. This is what we have to trace out of this whole system. So I offer our heartfelt welcome and good wishes to all our guest speakers of today evening, and we are eager enough to learn a lot of things from them. So thank you very much, and over to Pawan Sharma ji for further proceedings. Thank you. Namaskar.
Thank you very much, sir. We are really overwhelmed that today 10 dignitary speakers are going to bless us. One humble request with all the speakers, please take the consideration of time. Maximum 10 to 15 minutes can be the suitable time for speaker. And in that particular time, we would like to learn the gist from every speaker, the practical experiences, the medicines, whichever it may be suitable and perfect for students, senior doctors, as well as society. So without wasting much time, I would like to welcome my dear friend, my brother, Dr. Suhas Sethi, Principal, KLE Belgavi. Really, you have supported like anything, Dr. Suhas. I salute your zeal. Welcome, Dr. Suhas. Welcome.
Thank you, sir. Thank you very much. A very good evening to all of you and wishing you all a very happy World Mental Health Day. As you all know that October 10th is celebrated as World Mental Health Day every year with a great hope and a great vision of creating awareness among the people regarding the mental health. As we all know that mental health issue is a very big issue across the globe, and not only in the different parts of the globe, but equally in the developing country like India. So that is where probably creating more and more awareness among the mental health, because there is always a lot of social stigma attached with mental health. And that is where we have to just come out of this particular taboo that it's okay that people also could suffer with mental health. Just as we suffer with physical problem, we also could have the mental health issues. It's very much okay to suffer, and it's very much okay to reach to a mental health professional, to a specialist who are expert in mental health, so that they can be identified and they can really be taken care. See, if you look at the few of the statistics that has been done in India, we feel that there are more than 14 to 15% of the population suffering with mental health issues. And as per WHO statistics, around 1 lakh of the people who are suffering with mental health issues, more than 10,000 people commit suicides. And there are more number of young children who are addicted to the substance abuse in the near future. The surge of the depression and the anxiety has significantly increased after COVID-19 pandemic, and everybody realized the importance of the mental health issues. And that is where probably the theme for this year is that mental health is a universal right for everyone. It's not just a privilege, but it's a universal right for everyone to have the access, affordable care regarding to the mental health. So I'm very happy to be a part of this particular webinar, and having this experience of being practicing Manas Roga, being MD and PhD in Manas Roga, I like to share or summarize few of my experiences. I'll share my slides, and as warned by my brother Pavanji, I'll assure that I will finish in another 8 to 9 minutes. Sir, are you able to see the slides? Yeah. See, having this experience of practicing for more than 2 decades, we have done a lot of studies, both experimental studies as well as clinical studies on various drugs. Especially, I'm talking here about the single drugs. Apart from this, we also have done studies on the compound drugs, the herbal formulation, herbal mineral formulations. What I'm just trying to summarize is the studies that has been done on the single herbs, both preclinical as well as the clinical studies. And based on the experiences, we have tried to summarize them, how this can be used in different conditions. Ideally, we have different categories of these drugs, though we do not have very exact correlation, but based on the experiences of me and my department for the last 2 decades, this is what we have summarized, and this is where we are trying to use it in the clinical practice. The very potent anxiolytic drugs can be ashwagandha, brahmi, jatamamsi, and datura. Antidepressants, brahmi, jatamamsi, kapikachu, puga. The tranquilizers to calm down can be jyotishmati. Good to induce sleep, shankapushpi and mandukaparni. Anticonvulsant is shankapushpi, shigru, and the anesthetic can be ashwagandha. Neuroleptics are jyotishmati. The anti-stress is ashwagandha, tulsi, lashuna, punarnava. Few of the antipsychotics are ashwagandha, shankapushpi, mandukaparni. Neuroproductive can be ashwagandha. Antipsychotics again could be shankapushpi, mandukaparni. Anti-epileptic ashwagandha, brahmi, jatamamsi, and anti-Parkinson's is kapikachu. So these are based on the preclinical and the clinical research that we have done in our center. So I'd like to summarize 5 or 6 conditions, and I would like to summarize in terms of the disease, what would be the ideal shodhana or the panchakarma that should be done, what should be the ideal prescription in case of the shamana aushadhis, and what ideal sattva-vajaya chikitsa has to be done. The most common conditions that come to us and which is a major psychiatric disorders are the various psychotic disorders, which include schizophrenia, bipolar disorders, schizoaffective disorders, delusional disorders, and many other personality disorders. And all of them are understood in Ayurveda in terms of Unmada, which both has Nija Unmada as well as Agantuja Unmada. Ideally, if it is Vataja type of Unmada, the Shodhana would be Mustadi Apanabasti, Pittaja would be Virechana, and Kafaja Unmada would be Vamana. The ideal Shamana Aushadhis that can be used in Vataja Unmada are Kalyanaka Grita and Mahakalyanaka Grita. Pittaja, it can be Kushmana Grita and Brahmi Grita. Panchagavya Grita and Mahapaishachika Grita are ideal in case of Kafaja Unmada. Though initially we do not have much role in Sattva Chikitsa in Unmada, but later on you can adopt different Chikitsa like the Atmadi Chikitsa, like inside oriented family psychotherapy and the supportive psychotherapy. Apasmara, you can have 2 categories of treatment. One during the attack, other one is in between the attack. If it is in the attack, then you always should ensure that you do not cause any harm to the patients, and patient safety is very important. In such conditions, the Sanya Prabodhana Nasya, like Vacha, the white onion juice, the Katfala Churna, or the Shwasakuta Rasa Pradhaman Nasya can be done. And for Shamana Aushadhis, it can be, if it's Vega Kalina, like Kalyanaka Grita, Brahmi, Mahapaishachika Grita, Panchagavya Grita, and Smriti Sagar Rasa, Vata Kulantaka Rasa can be used. For Shodhana, again, Vata, Pitta, and Kapha. Generally, we have not done much of, because we tried initially with few of the Vamana, and we faced that patient had the attack during the Vamana. So now we have tried to avoid Vamana in the phases of recurrent epileptic seizures. But most oftenly, we try to go with either Virechana or followed by Nasya if it is Vata Pradhan Lakshanas. If there are Indriya Pradhan Lakshanas, we go with Nasya. For the Nidra Nasha, the ideal Panchakarma would be Murdni Tailas, which includes Kshirabala Taila, Brahmi Taila, Tungadruma Taila, as mentioned in Sastra Yoga. And Shamana Aushadhis includes Yashtimadu, Mamsadik Vata, Sarpagandhavati, and sleep hygiene. For various alcoholic related disorders and substance abuse, we should try to do a therapy combining of Vamana and Mrudu Anulomana, and use the drug combination which are good in Vatanulomana, Yakrit Uttejaka, Medya Rasayanas like Shrikanda Asava, Sumukti syrup, etc. And you need a lot of like family counseling, group counseling, individual psychotherapies, and repeat follow like Alcoholic Anonymous, which can be done in the form of cognitive behavioral therapy, family therapy, and the regular motivation. In case of anxiety disorders, ideally we should go with Virechana followed by Murdni Taila. The ideal drugs which can be used would be Ashwagandha, Tagara, Brahmi, and we should go for relaxation techniques, yoga and pranayama, where ideal, and especially the different types of meditation are said to be very suitable for anxiety disorders. For Vishada, the depression, one should go with Nasya and Vamana, and ideal Shamana Aushadhis includes Jyotishmati, Jatamamsi, Panchagavya Grita, and Purana Grita Nasya are very, very effective in the management of the depressive disorders. So we should go with supportive psychotherapy, dynamic physical activities, and the motivation. The preventive psychiatry plays a very important role along with nutritional psychiatry. And this is a model which I have been using especially for children and adolescent children, because it is seen that more than 14%, 40 to 50% of the children below the age of 14 suffering with psychiatric disorders. So ideally, this is a ABCD 4321 model for preventive psychiatry, where A stands for away from distraction, B for better planning of your life and priority of life, C for being able to enjoy and being cheerful, D for daily exercise, 4 liters of water, 3 times timely sattvic food, 2 times of prayer or a sense of self-motivating talk, and at least one recreational activities, which could be in the form of singing, dancing, cycling, long drive, going for a movie of any choice of your sex. I would like to conclude with this particular quote saying that how do you maintain a mental health? Nityam hita ahara vihara sevi samikshakari vishayeshu asaktaha dataha samaha satyaparaha kshamavan aptopasevicha bhavanti aroga. Regular intake of balanced diet and activities, being analytical, being detached, being kind and helpful, being truthful, having the mental equanimity and able to forgive the people and respect the teachers and elders will make a person away from all the different types of psychiatric disorders. So I think it's 10 minutes I've covered. Thank you very much.
On behalf of your contribution, no time is limited for you. No time is limited for you. You are the pillar of AYUSH SAMRIDDHI, dear. Thank you very much. Thank you very much.
No, I should listen to my big brother. So I followed you, sir. Thank you very much. And if there are any questions, I'll be very happy to answer.
Definitely, after the session.
Any of the participants can post their questions and I'll be very happy to answer. Thank you very much.
Thank you very much, Dr. Suhas. Thank you very much. Now I would like to invite Dr. Karthikeyan Natarajanji, very renowned name, started Dost Clinic, DOAST, for autism in Chennai, very renowned name in mental health disorders case. And he is blessing us from last 3 years. Welcome, sir. Welcome. Being a allopathic doctor, he is really our brand ambassador of natural treatment. Thank you. Thank you very much, sir. Now platform is yours, sir. Swagat. Welcome.
Thank you. Thank you so much. And once again, I come to this August audience. And this time, I want to share a very happy news to all of you that we have come to Bangalore. The services of the Dost Integrated Therapy Center has come to Bangalore also. And
congratulations. Congratulations.
And I'm spreading it through youngsters. And the topic of today for the Mental Health Day, the celebration or the observation here, the mental health has a lot of dimensions, and whether it is brain or mind or where is the mind situated, and the questions go on and on and on and on. So this time, even autism, whether it is due to the mind or the brain, I consider it is due to the brain and the inflammation, and that is why it is treatable. And 1940 to 1960, it was considered as psychiatric and then mental. So the situation has changed. So within this 15 minutes, we can't go into all these aspects. So this time, I request the chairman's permission to introduce 2 youngsters, because the world is going to belong to youngsters. See, the audience and the everyday webinar is directed towards the youngsters, because they are going to be the torchbearers for the science to follow. So I have 2 youngsters here, Prasanna Shriya and Prachidev. Prachidev is practicing in UK, and Prasanna Shriya is with me in my Dost Center. So I would like them to share their practical experience, one on managing children with autism and one on the mental health of parents of children with autism. Two different dimensions, and 2 youngsters here to share their experience. I would first like Prasanna Shriya to come over to share her experience or the kind of the concepts that she has on the mental health of parents of children with autism. Over to you, Prasanna Shriya.
Yeah, thank you, sir. Thank you, eminent doctors who are here. It's an honor for me to be amidst you all. Thank you, Dr. Karthikeyan, for giving me this opportunity. For me, the whole thing of mental health, how I started seeing is when I myself had to be a primary caregiver. So, which is when I understood what's the meaning of mental health, wellness, mental well-being, and things like that. Most of the time, these are taken for granted. Like we get up, we brush our teeth, we have a bath, we go and we come back. And there are days we have a headache, we think something is off for the day, and we finish and we either take a paracetamol and we think all is well. But once the day I became the primary caregiver for my parent, for my father, who was suffering from cancer, and I realized that how much I'm going to be personally affected. And with that, it dawned to me, as I did my master's project with Dr. Karthikeyan in 2018, how much will the parents of with autism children, will they be dealing on day-to-day basis? And what will be their scores of, be it clinical depression or anxiety? Whereas most of the time I have heard of people with mental health is illness. As I said, in my own case, I wouldn't still say I'm 100% fine, but I'm not clinically been observed for somebody to be tagging me as I'm clinically depressed. But these people, day in and day out, they work with their children. So the amount of anxiety and amount of stress that they would go through, it starts with first the denial. Everything is fine with my child. So it's like, how do you say? Everything is fine will be a straight line that you can imagine of. And then be it from the social circle, that is, be their own parents or the school or the neighbor, somebody pointing something is not right with your child. Why don't you get a checkup done? And from there, the journey starts for them, the mental health, wellness, which starts to be disrupted. So the denial comes in, is anything or everything fine with my child? And the anxiety kicks in from there. And when we take our inquiries in our own clinical setup, so the first thing what the parents say in our inquiry, we do give a column for what's the present complaint? Why have you come here for? Nothing, it's just the speech delay. So from there, when you dwell, and every time, you'll have to gently probe and not be very rude or in the name of showing them reality. The probing has to be very, very gentle. And it's about a 1 hour or 1.5 hours of inquiry that happens for each case. And by the time the parent, they go out, there are parents who are very happy, they shed tears. Okay, at least now I know where I am. So this would be the what we call as a golden time. Parents who come in 1 year, 1.5 years, 5 years, 6 years, 10 years. But there are parents who come in and they're 17 years, they're 24 years, 22 years. So they have passed through the journey of so many years that they have spent and going helter-skelter, not knowing where to go anymore, what to do anymore. It's just like what we say, we surrender and we leave everything to God. That was not what I did as a primary caregiver. So I would always, my empathy goes more in for the parents. I do see the child, but my empathy goes in for the parent, because unless their well-being is addressed, can they deliver to the child whatever we are requesting them or even suggesting? So my journey started with Sir. And as I said, I have seen people with denials, people with guilt. Have I done something wrong? And parents being very proactive. So be it proactive parents, which is sometimes even there is no agreement between husband and wife. There are parents, which means there are fathers only agreeing or mothers only agreeing. So from agreement, it starts on the mental health, what we are talking. So what could be delivered as a family to the child, the component breakage starts from there. So we've seen all aspects, 100% cooperative parents, they still do suffer, but the suffering is balanced between both the parents. We have seen families being broken down. We have seen suicidal cases. So I know a child, he was just 8 years old, and father died of a road accident. And the mother didn't know what to do because she had a child with autism. She didn't know what to do. She didn't know where to go. And she felt the best thing what she could do is to end her suffering is by suicide. And now the child, he could be anywhere between 17 to 20 years. He's been taken care of by his grandparent from the time I had known when I had met him as an 8-year-old boy. So we've seen a mixed array. And when I entered Dr. Karthikeyan sir's clinic, I came as a neurologist, meaning I was a neurosurgeon, not a neurologist, I would say more of a research purpose. So clinical neuroscientist. But I would say my focus is more on the parents, the primary caregivers for these children. And we've seen, I wouldn't call it a success, but parents leaving our clinical setup in a way where would they say, no, I'm happy that I've come to the right place. I can see a ray of hope, a smile on the face, and we are very happy to give that. And we do tell them the journey is a long journey. It's an 18-year-old. It's an 18-year journey from now on. When we catch them, when we say, no, the golden age of 1, 2, 3, 4, 5, 6. By the time the child comes to 18, he would be independent. To that level, we give hope, scope, and we travel with them in the journey. So with this, I just conclude, and I hope I made a presentation which was given to the time that I kept up with. Thank you.
Yeah, Prasanna.
Excellent, madam. Excellent.
You gave a presentation to primarily a physician-based conference. I tell them autism is a brain related.
Sir, I need your blessings tomorrow at your convenient time for 1 hour, because this is not satisfactory for us without your blessing. So I would like to request, humble request, that mental day celebration will be for 2nd day tomorrow. And I would like to start with Dr. Karthikeyan.
Okay, sir. Okay, I'll come. So,
And
Prasanna, you expanded the screen to a CinemaScope vision where you put everybody in the perspective, the child, the parent, and what you missed was the mental health of the doctors, you and me, who seeing these parents, how we cry inside, but we don't show it outside.
Yes,
okay?
sir.
Now I invite Prakshi Dev, a young psychologist who has done her bachelor's degree in India, and then she has gone to UK for her master's. So she is working with children with autism. And then Prakshi, come over and then share your experience about your journey in UK. There, I think it is all NIH controlled, which is different from the independence that we have in India. So why don't you come in, unmute yourself?
Yes, sir. Can you hear me?
Yeah, very well. Yeah.
Hello.
Badge.
Oh, yeah. I'm still at work, sorry.
Oh, okay. All the best. Thanks for coming.
Hello, everyone. It's a real honor to be here, sir. Thank you very much for this opportunity. I really appreciate it. As a mental health professional, I will say that we've truly achieved mental health awareness only after we are able to acknowledge and accept our own mental health difficulties and see what we require in the future, as rightly said by Prasanna and Dr. Karthikeyan. It is very important because we know we have, it's easier to point, at someone else that, okay, you might have to look into this and that for your mental health problems. But when the acknowledgement comes to self, it becomes easier to then go to the second part, which is consumption, not only consumption, but provision and consumption of mental health resources. So I think when the purpose of awareness intends to shift gears from looking at mental health problems as a taboo to looking at it as something that needs your attention, that's when I truly believe we'll reach that stage of actual mental health awareness that has been spread. Coming to autism, well, I am a novice in the field and I have learned, however, a lot in a short span of time. So I started working in an autistic school for primary children aged between 5 to 11. And even though I've been working for a short time, as I said, I've learned a lot. And I'm going to just tell you a gist of my learnings over here. When dealing with autistic children, I noticed that the teacher to student ratio is 1:1. Initially, I thought it was totally unnecessary or it felt too crowding. But then I realized that autism is a spectrum and it can present itself quite differently in each child. Each child is very unique or very different from one another. So today, even though I work in the preventive care of autism, unlike Dr. Karthikeyan, who works at the grassroots level, I would like to say that not one solution fits all. I'm sure that's true in every field. So it applies here as well. It's very important to make sure that we understand the child in and out, understand his or her strengths and limitations, and curate a very personalized plan for the child. Coming to technology, we've had the long conversation of whether technology is a boon or bane. But coming here, I have realized that assistive technology for these children definitely provides an option to communicate. Otherwise, apart from the verbal way, we can also incorporate the use of technology to just give them an option and see if they're able to master it. Because to my surprise, when I started working here and they gave me an iPad with the software downloaded, I thought, okay, what will children do with this? They would not know how to deal with it at all. But my very first day, one child, tries to grab my attention and he's like, I want red ball. And I was amazed. And I feel like it is a very good way of actually using technology to communicate. Coming to the last one that I realized is the careful transitioning of high-functioning autistic children into society. Not just that, we have a lot of professionals today, such as ABA practitioners, such as Ayurvedic practitioners, or social workers, psychologists, psychiatrists. We have all the resources required. We have all the professionals in India. And not just that, India's treasure lies in Vedic literature, which have now converted into professions like Ayurveda. So I feel it is very important for us to utilize them and provide that holistic treatment that we can provide to the autistic child. So this is all that I've learned as of now. I'm sure there is so much more that I need to learn, but I'm sure we can reach that point where we can all join hands together and provide that to the child. Thank you very much.
Thank you, Prachi. We are already joined hands. And then see, we here in India as a team prepare the soil, and the soil is ready for you to sow the seeds. And then that makes the children independent. See, that is what is the concept of the integrated therapy that we are working on. And thank you so much for both you youngsters to come and present your views. And then thank you so much for the audience. Thank you so much, sir.
Thank you. मन अभी भरा नहीं सर, मन अभी भरा नहीं, कल फिर मिलेंगे हम लोग. जय हो. So now I would like to request Dr. Shyam Sundar Sharma ji. He has joined right from the beginning. Welcome, sir. It's your first time on the platform, but this platform is yours now. We are yours. We are circulating our plan on every first of the month. And I'm really grateful to Dr. Mahendra Chaturvedi ji. Thank you, Mahendra sir. Thank you very much. Shyam Sundar.
Thank you, sir. First of all, I would like to thank for inviting me for this international webinar organized by AYUSH SAMRIDDHI. And I would like to thank convener and the host, you, sir, Professor Dr. Pawan Kumar Ji Sharma, Professor Vishnuji Sharma, and Professor Vinit Kumar Ji Sharma. As all speakers, they are talking about medicines and their experiences. आयुर्वेद के अनुसार मैं जाऊंगा सर, तो चरक संहिता में आचार्य चरक ने जो एक चिकित्सा बताई है, तत्वावजय चिकित्सा, उसके ऊपर मैं थोड़ा एक्सपीरियंस आपको बताना चाहूंगा। तत्वावजय जो चरक सूत्र स्थान में बताया है अध्याय 1 में, तत्वावजय चिकित्सा, दो शब्द हैं, तत्वावजय और चिकित्सा। चिकित्सा हम किसकी करते हैं और क्यों करते हैं, इस पे ध्यान देना पड़ता है, क्योंकि ये मेंटल हेल्थ से रिलेटेड है। तो जो सत्वावजय है उसमें दो शब्द आते हैं, सत्व और अवजय, यानी टू ओवरकम। किस चीज से? जो भी चीजें ऐसी हैं जो मन को इफेक्ट करती हैं, तो सत्वावजय चिकित्सा इट इज रिलेटेड टू योर माइंड, आपके मन से इसका संबंध है। और खास बात ये है कि आयुर्वेद में मेडिसिन से भी आप ट्रीटमेंट करते हो, लेकिन बिना मेडिसिन के, बिना औषधि के जो ट्रीटमेंट किया जाता है, दैट इज नोन एज सत्वावजय चिकित्सा। ये आयुर्वेदिक साइकोथेरेपी, और वी कैन से दैट नॉन फार्माकोलॉजिकल अप्रोच है। अब प्रॉब्लम तो है उनको, बड़ों को भी है, बच्चों को भी है, सबको होती है। इसका डायरेक्टली इफेक्ट होता है मन के ऊपर। मन के ऊपर कैसे होता है? अब हमारी जो प्रकृति है, जो हमारा स्वभाव है, उसके कारण से होता है, मन के ऊपर इसका इफेक्ट होता है। अभी मन, हम जब किसी केस को हैंडल करने जाते हैं तो उसके लिए हम देखना पड़ता है कि मन दो तरीके से काम करता है। मन दो तरीके से काम करता है, एक तो पॉजिटिव वे में भी काम करता है और नेगेटिव वे में भी काम करता है। तो पॉजिटिव में अगर है तो आप उसमें सकारात्मक भाव से उसको पॉजिटिवली लेके जाते हैं, और जो नेगेटिव होता है वो आपको नेगेटिव लेके जाते हैं। अभी इसमें जैसे कि चिकित्सा करेंगे हम किसकी? हेल्थ के हिसाब से अगर हम देखते हैं आयुर्वेद की दृष्टि से, तो हम तन की भी चिकित्सा करते हैं औषधियों से, और मन की चिकित्सा की जाती है जिसमें हम अलग अलग उसके उपाय होते हैं, यानी बिना किसी मेडिसिन के इसकी ट्रीटमेंट की जाती है। अभी मन जो है, आपको जैसे मैंने कहा कि पॉजिटिव वे में भी होता है, नेगेटिव वे में भी हो जाता है, इस तरीके से ये होता है। अब उसके इफेक्ट क्या होते हैं? मन के बारे में मैं थोड़ा बताना चाहूंगा, क्योंकि मन जो है वो आपकी प्रकृति के ऊपर डिपेंड करता है। तो जो व्यक्ति है जो मानसिक पीड़ित है, जिसके मेंटल डिसऑर्डर्स है, उसकी आपको प्रकृति देखनी पड़ेगी। अब प्रकृति 3 प्रकार की होती है, सात्विक प्रकृति, राजस प्रकृति और तामस प्रकृति। सत्वावजय में जो शब्द सत्व आया है, उसका संस्कृत वर्ड सत्य से उसका रिलेशन है, और सत्य का मतलब है कि सात्विक जो प्रकृति है उससे उसका रिलेशन है। और बाकी जो है राजस और तामस प्रकृति, इन दोनों को भी हमको ध्यान में देना होता है कि किस कारण से ये तकलीफ आती है, ये मानसिक पीड़ाएं क्यों होती है। जब कभी सात्विक प्रकृति जो है वो अगर कम होती है, तो होता क्या है कि जो राजस और तामस प्रकृति है वो बढ़ती है, और जब राजस और तामस प्रकृति बढ़ती है तो आपके जो भी मानसिक विकार है उनको प्रभावित करते हैं, आपके जो मन है उसके विचारों को प्रभावित करते हैं। तो हमें इसको बिना मेडिसिन के ट्रीटमेंट देना होता है। तो हम क्या करेंगे? तो सत्व गण हो उसको हम बढ़ाने की कोशिश करें, क्योंकि हमें सत्व से ही उसको विजय प्राप्त करवानी है। जो सत्व है, सत्व गुण है, पॉजिटिविटी है, उसके कारण से ही आप उसमें आगे बढ़ सकते हैं, नहीं तो कोई चांस नहीं बनता है। तो जैसे जैसे हम सत्व गुण को बढ़ाने लगते हैं, वैसे वैसे तामस और राजस गुण ये अपने आप धीरे धीरे कम होने लगते हैं। अब इसके लिए क्या क्या उपाय हो सकते हैं वो मैं आपको थोड़ा बताना चाहूंगा। आचार्य चरक ने कहा है कि मानसो ज्ञान विज्ञान धैर्य स्मृति समाधि भी, इसमें ये उपाय बताए हैं कि जो ऐसा व्यक्ति है जो मानसिक पीड़ा वाला है उसके साथ में कैसे करें हम उसका ट्रीटमेंट। उसके लिए उन्होंने बताया कि ज्ञान विज्ञान, ज्ञान क्या हुआ, आत्मज्ञान। वो जो व्यक्ति जो पीड़ित है उसे अपने आप के बारे में आप अपने व्यवहार से, आपकी बातों से उसको ये बताने की कोशिश करें कि आपको ये जो प्रॉब्लम है ये नहीं है, इसको आपको ये समझना चाहिए कि ये जो प्रॉब्लम है ये धीरे धीरे निकलने वाली है। उसको इस तरीके का आत्मज्ञान, और उसे अपने जीवन के बारे में बताना चाहिए कि हताश नहीं होना है। आपको जीवन है जो बड़ी मुश्किल से मिला है उसको पॉजिटिव वे में लेकर के आपको जीना है। इस तरीके से उसको हम ज्ञान देते हैं कि आत्मज्ञान है। विज्ञान क्या है, शास्त्रों का ज्ञान है। शास्त्रों के द्वारा हम उसको इस तरीके की बातें बताने की कोशिश करते हैं जिससे उसमें मानसिक बदलाव आने लगे। इसके बाद में आचार्य चरक ने जो धैर्य बताया है, धैर्य इज मोस्ट इंपोर्टेंट। जो धीरता, धीरज जिसमें हो, पेशेंस, तो कंट्रोल द पेशेंस, कंट्रोल द माइंड। इस तरीके से है कि हम उस व्यक्ति को ये कहना बताएंगे कि धैर्य रखो आप। इसमें देखिए जो व्यक्ति है पीड़ित है उसे तो व्याधि है, लेकिन ये जिम्मेदारी बनती है परिवार वालों की। जो चिकित्सक है उसकी तो जिम्मेदारी होती ही है, लेकिन परिवार वालों की भी जिम्मेदारी होती है कि वो उसे धैर्य दे, उसे तिरस्कृत नहीं करे। और उसके बाद में इसकी जो स्मृति है, स्मरण शक्ति है, उसके ऊपर उससे पुरानी चीजें वो याद दिलाए, जब वो अच्छा था या अच्छी थी, जब वो बच्चा स्कूल में अच्छे से पढ़ता था, अच्छे मार्क्स आते थे, और धीरे धीरे उसको मानसिक रूप से ये पीड़ा होने लगी, उसमें कॉम्प्लेक्स आने लगता है। तो उसे धीरे धीरे उसकी स्मरण शक्ति की तरफ लेके जाना पड़ेगा। और समाधि जो लास्ट में बताया है, समाधि का अर्थ ये है कि मन को विषयों से हटाकर आत्मा में नियमन करना होता है, यानी सेल्फ रियलाइजेशन। मुश्किल काम होता है, लेकिन अगर धैर्य रखा जाए तो धीरे 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 उसमें होने लगता है। अब ऐसे व्यक्ति को अगर आप बोले कि आप किसी चीज में इंटरेस्ट नहीं लें, तो ये तो दिस इज नॉट पॉसिबल ना, क्योंकि जो भी हमारे सेंसेस हैं, जो इंद्रियां हैं, वो बुरे तो नहीं है। आपको अगर दिखाई देता है तो आंखों का कारण से दिखाई देता है, आपको गंध आती है तो आपके नाक के कारण से आती है। तो ये जो सेंसेस हैं ये आपके अच्छे हैं, विषय हैं वो भी अच्छे हैं, लेकिन किसी एक विषय में आप अगर घुस गए और उसी के पीछे लग गए, जो आसक्ति बोलते हैं, ममता बोलते हैं जो, तो वो आपका जो है वो आपको मानसिक पीड़ा देने वाला है। तो विषयों को बुरा नहीं करके मन को आपको उन विषयों से दूर रखने का प्रयास किया जाता है। तो जो मेंटल डिसऑर्डर वाले हैं, मेंटल हेल्थ की जिनको प्रॉब्लम है, उनको विषयों से आप ये न कहें कि विषय बुरे हैं, नहीं, वो मानेंगे नहीं। उनको समझाना पड़ेगा धीरे धीरे कि भाई विषय जो हैं, एक ही विषय में लगना ठीक नहीं है, अलग अलग विषयों में आपको लेना पड़ता है। अभी जिस तरीके का कोई व्यक्ति है उसे उस तरीके के अनुसार समझाया जाता है। इसमें धर्म, अर्थ, काम, इसके बारे में भी विचार पूर्वक उसको पालन किया जाता है। ये सारी चीजें जो है उसको मानसिक पीड़ा को कम करने के लिए की जाती है। अब इसके अलावा जो मुख्य रूप से व्यवहार में जो काम में लेने की चीजें होती है मेंटल डिसऑर्डर में, वो है आश्वासन देना, यानी उसमें रीअश्योरेंस और एक्सप्लेनेशन आपको देना चाहिए। कई बार प्रश्न उठते हैं मरीज के साथ में, परिवार वालों के साथ में, परिवार वालों को भी डाउट होता है कि क्या होगा, ठीक होगा कि नहीं होगा। तो उन्हें इस तरीके से बताना चाहिए कि जैसे दिन के बाद रात है, रात के बाद दिन आता है, सुख के बाद सुख आता है, दुख आता है, इस तरीके से उसमें ये देना चाहिए। अब उसमें आगे आता है कि उससे अच्छी बातें करनी चाहिए, सुहृद वाक्य कहा गया है, यानी गाइडेंस, और उसमें सजेशन देना होता है। आप उनको करके बताइए कि इस तरीके से आपको करना चाहिए, और उसके लिए आपको सजेशन देना होता है, घर वालों को भी देना होता है, और जो पीड़ित है उसको भी देना होता है। कैसे? आगे उसमें जैसे धर्म कर्म है उसके बारे में भी बताया जाता है, धर्मार्थ के बारे में कि आपका वातावरण वहां पवित्र रखा जाए, घर का, शास्त्रों का पाठन किया जाए, इस तरीके से करते हैं। फिर एक विशेष बात है कि उस व्यक्ति की रुचि क्या है, तो उसे उस रुचि के अनुसार ऐसे सीन सीनरी दिखाने चाहिए, अद्भुत दृश्य दिखाने चाहिए जिसमें उसकी रुचि हो, जिसमें उसका मन भाए, जिसमें उसको लगाव हो और उसका डाइवर्शन हो। अदरवाइज होता क्या है कि जो मानसिक पीड़ित वाले हैं वो केवल अपने उसी धुन में लगे रहते हैं, जो एक विचार जो उनमें आ गया उस विचार को छोड़ नहीं पाते। तो उसे ये बताना चाहिए कि धीरे 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 करते करते होना चाहिए। हम जो दृश्य दिखाते हैं उसमें ये नहीं हो तो डरावने पिक्चर्स हो, विभत्स ऐसे भयंकर, इस तरीके से नहीं, क्योंकि मानसिक डिसऑर्डर है, मेंटल उनका प्रॉब्लम है, तो उसे ऐसी चीजें दिखाए जो रुचिकर हो। अगर आपने गलत दिखा दिया तो आपका बिल्कुल केस बिगड़ने का चांस है। तो लास्ट में मैं ये कहूंगा कि सांत्वना जो होती है, रिहेबिलिटेशन और रीअश्योरेंस, ये उसमें बहुत जरूरी है। इसमें आप परिवार वालों को भी सांत्वना देते हैं और जो पीड़ित है उसको भी देते हैं। इसमें भगवत गीता में कहा है कि जो प्रकृति होती है 3 प्रकार की, उसके लिए भी उन्होंने कहा है कि सत्वम रजस्तम इति गुणः प्रकृति संभवा, ये प्रकृति से उत्पन्न वाले गुण है ये। और इसको आप ये देह जो प्रकृति और जड़ और चेतन, ये समझ लीजिए आप, उसके चेतन में ये सारी चीजें नहीं होती, अपने शरीर में ही रखा हुआ है ये भाव जो आते हैं। तो हमें ये भाव लेना होता है और वो भाव के अनुसार ही उसको समझाना पड़ता है। सबसे चीज क्या हुई कि उसको आप उसकी वो जो चीज है रुचिकर, उसी में उसको दिखाएं। अंत में मैं आपको ये कहना चाहूंगा कि जो आत्मज्ञान इसमें आता है, यानी जो मैं कौन हूँ, उस व्यक्ति को समझाना चाहिए, परिवार को समझाना चाहिए, वो क्या करे, उसके लिए कौन सा हितकारी है, ऐसी चीजों का ध्यान देना चाहिए। फिर जो अलग अलग देश काल, उसका बल, शारीरिक बल, इसका भी ज्ञान होना चाहिए, चिकित्सक को भी होना चाहिए और उस मरीज का भी होना चाहिए कि चिकित्सा में हम उसको कितना बात करें, कौन सा काम करने को बताएं उसको। जैसे देश है तो उस देश में कौन सा दोष प्रकोपित होता है, कौन सा उसका काल है, काल में उसका पथ्य अपथ्य, वो भी सब आपको ध्यान रखना पड़ता है। ये सारी चीजें उसमें आपको ध्यान रखने की जरूरत होती है। उसकी सारी जो शारीरिक बल है, उसका मानसिक बल है, उसका आपको अंदाजा होना चाहिए चिकित्सक को। उसके बाद में उसको आप ये सारी चीजें कर सकते हैं। तो धीरे धीरे ये सकारात्मक चीजें करने से उसके भाव में बदलाव आए और आत्मविश्वास बढ़ता है उसमें, और मानसिक सुधार होते होते धीरे धीरे वो हो जाता है। एक चीज मैं और कहना चाहूंगा अंत में कि जब आयुर्वेदिक औषधि से चिकित्सा करते हैं, उसके साथ में भी हम तत्वावधायी चिकित्सा करें तो अधिक लाभ होता है। धन्यवाद।
बहुत आभार, बहुत अच्छा बोलते हैं। आज से हमने आपको दिया समर्पित भाव से, जुड़ते रहिए। मेरी महेंद्र जी को भी बहुत बहुत धन्यवाद, महेंद्र जी को भी बहुत। मैं
समय का ध्यान रखा, मैं बोला समय में रहूं।
जय हो, जय हो, जय हो। I would like to request now Dr. Dhananjay Patel from Jamnagar. Dr. Dhananjay ji. With Dhananjay V. Patel from Jamnagar. Welcome. Welcome, Dr. Patel. अब मैं झंडू में नहीं रहा, पवन शर्मा मानसरोवर कर लो भाई। Welcome. Your screen is visible. Your voice is not coming, doctor.
Now, am I audible?
Yes, clear, clear.
Okay. Should I start?
Yes, welcome, welcome.
Thank you very much, sir. Thank you very much for giving me an opportunity to share my some thoughts on a mental health on the day of World Mental Health. And the theme of today's Mental Health Day is mental health is a universal human right. So I am going to talk about some problems about MUN and some minor disease like a stress and angerness and stress-induced psychosomatic disorders. And I mostly speak about Ayurveda only, since I am not, having good knowledge of allopathic or modern psychiatry. From the Ayurvedic point of view, as we know that, the concept of mana is already there in our Shastras, literatures, and it is from the beginning only, when the Ayu is described, it said that Sarir Indriya Sattva Atma Sanyogdhari Jivitam. So it is a combination of Sarir, Indriya, Man and Atma for a certain period of time. And Ayu's, maximum it is 100 years in a Kali Yuga. So for 100 years, this Sarir, Man, Atma and Indriya together. And is like Sarira, Man is also, affected with the external forces, and it is very likely that the Man is also maybe diseased. So how to understand? Let's try to, focus on that. Some of the things we know, like Sharira, it is dos dhatu malmulam hi shariram, But similarly, Man is also made from some things which is functional only, not structural, as like dos dhatu and mala. In Ayurveda also, dos dhatu mal is functional rather than the structural. So as like dosha, there is a guna in mana, that is sattva, raja and tama. As like dhatu, in manasa, there is a manasa bhava, like krodha, shoka, harsha, bhaya, avasthana, shraddha. So this manas bhava is to be considered, which makes a mana. And since, the sarir is structural, it has mala, but man is functional only, so it does not have any mala. But for sarira, the ball, everything is depend on Agni, which, digest the food and make a, makes a dhatu, nutrient dhatu. And very similarly, man is also having, sadhaka pitta. And Acharya Susruta has already told that this pitta also, like 5 agnis. So sadhaka agni resides in hridaya, as like, jatragni resides in amashaya, and whatever we have makes a dhatu. Very similarly, whatever, the thoughts coming in our mind, whatever the, our mind accepts, artha, actually it is, perceptions are received by the indriyas, but the emotions like angerness, frustration, sorrowness, everything is, that artha is received by the mana, and on that sadhakagni works, and accordingly, it makes our mana. So our the body is like rasasara, raktasara. Similar way, we have a krodhasara, shokasara, harshasara, personsara. So there we have seen also in the society that some of the people are, having a short temper, and they're always ready to fight with each other. Whereas another persons do not respond to any event. They are always in sadness. And some of the people are, very jolly. So different kind of nature we can see. We can, that can be compared with, the sarata, like a tvakasara, raktasara, etc., etc. Our literature was written very early, 5,000 years back. And at that time, somatic disorders are more, and the psychic disorders are, or mansik disorders are less. So less focus has been given to the mana, especially the disease of a mana, whereas more focus was given to the sarira. But nowadays, the scenario is changed, and our lifestyle is, we make such a way that the stress-induced diseases are more coming. Stress-induced lifestyle diseases are more coming, and WHO also said that, the 21st century is the century of stress and stress-induced psychosomatic disorders. Earlier, 20th century, it was a century of, earlier the century, 20th century is a century of infectious disorders, but now this is the century of psychosomatic disorders, because nearly 50% of the disease have directly or indirectly a role of cycle. So we need to understand that. Just before my lecture, Dr. Shyam Sundar has said that there are 3 types of mana or nature, prakruti, mansik prakruti, satvik, rajsik, and tamsik. We already know it. We also, it is said in our samhitas that mana, based on its strength, can be categorized as a pravara, madhyama, and a avara sattva. So pravara sattva are the people who have best of mental strength. They usually do not disturb with the positive or negative circumstances. Even in a big problem, they can remain stable. But those who are having madhyama sattva, they are easily affected with the circumstances, whether it is good or bad. They easily affected, and these people have a psychological problems. The pravar sattva persons, they generally do not have any psychiatric problems. They remain stable in all the conditions. But the madhyam sattva people, they got affected, and they have some problems like anxiety, depression, sadness, etc., etc. But the third one is our sattva person. These kind of people are very easily affected, rather than they are used to affected and they are living in anxiety and depression, in that kind of condition only. They generally do not come out from these problems. And even if you are trying to take care of this our sattva person with the counseling, with the medicine, they will not come out from it. They lives in a depressed condition, in anxious condition. So this kind of people, even this kind of people, this kind of patients rather than the people, will give up apayasha. So we have to take care while treating them. But the madhyam sattva persons, we can with the counseling, with the medhyarasha, and we can treat them. Manas bhav, we already knew it. There are harsha, dhairya, virya, bhaya, etc. Manas bhava, which can be divided in 2 groups, positive as well as negative. There is no such actually positive and negative. It is just for understanding. We have categorized it. Otherwise, there is nothing like negative. For an example, krodha. If somebody asks us that Bharat is a bad country and people of Bharat are bad, so we obviously have a krodha, and it is natural. So there is nothing, krodha is negative or harsha and there is positive. Actually, it is already there as like dhatu we are having. It is this manas bhava are already there in mana of everyone. But to understand it, we have categorized in positive and negative, and there are its importance also in the treatment. So we have categorized it. This is the common samprapti, of manas vikara, especially the small disorders, not severe chronic conditions like unmada and apasmara, but all kind of. In fact, unmada and apasmara, initially it is started with istasya labhata, anistasya labhata cha. It is given by Acharya Charaka that if we wish something and it is not happen, if we desire to have something and if we are not getting, obviously we are unhappy. And vice versa, if we want something not happen to us, accident, we do not wish that it happened to us, but if happened to us, then it is very likely that we becomes unhappy, and with this our rajas and tamasa are increased, and that leads to mansik dos prakop of raja and tama, and sattva guna is reduced. whenever these doshas are provoked, the positive manas bhavas like dharya, avasthana, shraddha are reduced or deteriorated, whereas the negative manas bhavas are increased like moha, kama, krodha, lobha, raga, shoka, etc., etc. Up to the certain limit, the increase of negative manas bhava and decrease of positive manas bhava, still they are considered as manas bhava only. But when they cross the physiological limit, they are considered as a manasa vikara. And
In
after,
brief, doctor,
please.
today 15 minutes time total is there, so 7 minutes left.
Okay, no problem, sir. We'll
Thank
conclude it within the time.
Okay.
1 or 2 minutes here and there. Okay. Okay. So when it crosses the physiological limit, they are considered as a manasa vikara. And that is the reason that Acharya Charaka has said that lobha, shoka, bhaya, krodha, mana, vegana vidharayata. We have to hold this vegas. It is described in Sutrasthan 7, na vegan dharani adhyaya, where he has suggested that all the vegas, the defecation, the kshuda, the asru, etc., we should not hold it. But at the same time, he had suggested for well-being, we have to hold this, psychological vegas for the health of, for the better mental health. And when this manasa vikara, manas bhava cross the physiological limit, it becomes manas vikara, which affects the mana and leads to manava srota dusti, and leading to manas vikara like anxiety, depression, irritability, etc., etc. And even if this condition is not properly treated and some bad circumstances is going on, this manas vikara convert in manas roga. It is a severe pathological conditions like unmada, apasmara, atattva abhinivesha, likewise. So, but nowadays we people being Ayurvedic physicians, we generally do not have to treat such a severe, manas roga people. We used to treat manas vikara, and these kind of problems are more in our society. So how to treat? This is a big issue. So from the Ayurvedic point of view, it is said that very first we have to do Nidan Parivarchana. So here in case of, in Manas Roga also we have to consider it, and we have to do Nidan Parivarchana, whether it is stress from any of the sides, it is from the boss, it is from the financial matter, it is from the social problems or family problems, anything. We have to correct it. Then if it is a psychosomatic disorders like hypertension, diabetes, or ulcerative colitis, we have to consider the srotas of that disease, and accordingly we have to do Vyadhi Pratinyak for chikitsa. Then since it is a manas involvement, we have to give mental health promoting Madhya Rasayana, and also we have to do Patya Patya. So let's try to understand it from the first Nidan Parivarjana. For an example, a person having a problem with the father, or problem with the brother, or the person having a problem with the wife, or sas bahu problems. They are living together. It is not possible to avoid it. In that case is, if we change our attitude, that is very, very well described by Dr. Shyam Sundar, that Manasho Jnana Vijnana Dharya Smruti Samadhi Adibi. With that, we have to understand our condition, and accordingly, we have to take it positively. So, we cannot avoid it. We cannot, take a divorce from the husband if we have a problem with the husband. But we can have a positive attitude. For an example, husband is, asking every time, where are you going? What are you doing? If wife take it as it is, watching or observing her and constantly focusing on her, so it may be irritating. But if she thinks that his husband is so much taking a care, so every time, he asks me, where are you and what are you doing? So this way, if we take it positively, they can avoid Nidan Parivarchanas. And our job is to counsel the patients, what Lord Krishna has did with Arjuna in the battle of Mahabharata. As per the disease, for an example, ulcerative colitis, we will give a pichabasti or some grahi aushadha. If there is a diabetes, we will give anti-diabetic medicine likewise. And in also we have to give a Medhya Rasayana. But while we are prescribing Medhya Rasayana, we used to give combination of Sangpushpi, Brahmi, Ashwagandha, Jatamasi, Yasti, whatever we know, and whatever available in our dispensary. Instead of that, we have to take care that if the person is having this manas bhava in higher side, for an example, the person is having very irritative and angerness, or whose temper is short. In that kind of condition, we have to calm down, and for calm down, we can give some medicine like Brahmi, Shampushpi, Jatamasi, etc., etc. Where in such conditions where the patient is in depression, sorrowness, in that kind of condition, we have to, increase this manas bhava. For that, ashwagandha, yasti, vacha, kapikachu, these are the very good medicine. And there are, some conditions where we will find a mixed kind of pathology. Manas bhava increase and sometimes decrease also. So in that condition, some pushpi is very good. And pathya, we generally avoid it, but in manas psychosomatic disorders, Pathya Ahar Vihar is very important, and we have to follow the Achar Rasayana. It is very well described in our literature also. Pathya Ahara, well, it is not a concept of Ayurveda, but it is in Gita that we have to, in Gita 17th chapter, the Satvik Ahar one has to take. Not only Ahara, but how it is prepared, it is also very important. For an example, ghee is a Satvik, milk is a Satvik, but when it is, we make a curd, it becomes tamasic. And if we prepared buttermilk from the curd, again, it becomes a rajasic. So we have to understand how the food is also prepared. Grith is very important. We have to take it. Unfortunately, nowadays, modern doctors suggesting that it is very bad, increasing cholesterol, but it is not like that. If we have a cow ghee, it does not have any problem. But here we know understanding of yoga, vyayama, but we generally miss the schedules. Nowadays it becomes a habit. We used to late night awaking, and we sleep for a morning and did not start our schedule at Brahma Mud. So it is very important to start early morning, and for that we need to understand the Achar Rasayana, and we also have to follow it to reduce the mental health. Some research work we have conducted. In one group, we have given anti-diabetic Ayurvedic medicine, and another group, we have added anti-diabetic medicine with mental health promoting drugs, Sangpushpi. It was, open label clinical trial. And we have found that when, the Medhya Rasayana is added, we have better results in fasting as well as postprandial blood sugar. So, and we have also find a very good result on blood pressure also with the Medhya Rasayana and Sirodhara. At last, I would like to say that we are having, very good culture that in that we do believe that Sarva Bhavantu Sukhina Sarve Shantu Niramaya. So we want that everybody remains happy and everybody remains disease free, and no one has to be a part of any unhappy or undesirable event. With this, I would like to say thank you for Dr. Pawan Sharma giving me an opportunity to share some of the thoughts on Manas Bhava. Thank you very much.
This platform is yours, Dr. Dhananjay. Please tell me when you want to, what is the topic of your choice. We will invite you definitely. Thank you very much.
Thank you very much. If you are invite me again, would like to discuss on Achara Rasayana, 15 to 20 minutes or 30 minutes. It is very important, but since the topic is big one and the time is very less, and there are many good, professors are there. So, tomorrow for 3 days I am busy out of stations, 3-4 days.
Okay, then we will plan
so later we will decide it later.
Thank you. So nice of you. So nice of
you. Thank you very much, sir.
Now I would like to request Dr. Niranjan S. Acharya. Welcome, Dr. Niranjan ji. Welcome.
Namaste, sir. Is it audible?
You are audible but not visible. You are audible.
Okay. Okay. So at the outset, I would like to thank you, sir, for giving me an opportunity to speak a few words related with mental health. Okay. Ayurveda and sorry, Ayurveda for mental well-being. Okay. And we all know that for a person to be successful, there should be physical fitness, there should be financial stability, there should be acceptance in the society, and of course, there should be mental peace also. Mental peace and happiness should also be there for a person to be named as a successful personality. Okay, so all these four factors are interrelated. The mental peace as well as physical fitness, mental peace as well as acceptance in the society, all these are interrelated with each other. And if there is no mental peace, definitely that will affect his physical fitness, and again that will affect the person's acceptance in the society also. Okay, and then we cannot call that person as a successful personality. So to call the person as a successful personality, we should have mental peace also, which is already mentioned in our science. Samudosha Samangi Samdhatmalpriya Prasanna Atma Indriya Manaha. Okay, there very specifically in our Shastra it has been mentioned. So most of the things our Suhas sir and all the previous guest speakers have told. So, and most of the things what I follow normally, Shiva sir, I follow most of the things. Okay, and I generally follow ABCD 4321 model in my clinic also. What sir told. Uh, anyway, uh, to begin with the topic, I would like to mention a few aspects. See, we know that. mm, uh, Ayurveda for mental well-being, okay, it can be understood in two ways. Okay, mental well-being, swasthasya swastrashan, to maintain the health or mental health of a healthy person, and aturasya vikara prashaman, or to cure the disease. Okay, so for that purpose, we have to understand whenever a patient comes to you, we have to understand the patient in four different quadrants. Okay, four different quadrants in the sense whether the patient lies in the category of I am okay and you are okay, whether the here I refers to the patient, you refers to the other person. Okay, what I'm saying is whether the patient lies in I am okay and you are okay position, whether the patient lies in I am okay, you are not okay. Third category is whether the patient lies in I am not okay, you are okay, and in fourth category the patient says that I am also not okay and you are also not okay. I'll explain one by one. See, when the patient is in the category of I am okay, you are okay, there is nothing but he is a normal individual itself. He is not a patient as such. There must be some stress might have been there that the patient is not is in that particular situation he is affected. I am okay. I am perfectly okay, and you are also okay. Okay, that category is called as a normal individual. It is also we can consider that he is a healthy person. In the second category, where the patient says that I am okay, but you are not okay. Here, we can consider some of the psychotic patients. Psychotic patients, in the sense, the patients will not accept that they are having the disease. Okay, psychotic patients. Some of the psychotic patients, they say that they believe that they do not have the problem. In fact, the other person is having the problem that he is not able to understand his problem. Okay, so in that situation, we group the patient as I am okay and you are not okay. And of course, it may be normal individual also, provided the other person should be abnormal. Okay. And in the third category, where the patient lies, I am not okay, you are okay. Generally, all the neurotic cases come under this category. Neurotic cases is anxiety, depression, OCD, phobia, panic disorder, sleep disorders, etc. All the neurotic cases come under this category. And psychotherapy definitely works in this category. See, we have to, whenever the patient comes to your clinic, first we have to differentiate whether the patient lies in neurotic category or a psychotic category. Okay, if the patient lies in neurotic category, like the neurotic category in the sense, patient is able to understand that he is having the disease, he is having some trouble, he is facing certain problems, and he want to get rid of these problems. Okay, so, and he has come to you, he has approached you for the treatment purpose. So these patients are grouped under the heading of neurotics. Normally, anxiety, depression, obsessive compulsive disorder, phobia, and sleep disorders, all these can be considered under the heading of neurotics, and definitely psychotherapy will work in these group of diseases. And in the fourth category, where the patient says that I am not okay, you are also not okay. In the sense, here severe psychotic conditions in sense, schizophrenia, mania, delusional disorders, severe variety of bipolar affective disorders. All these can be grouped under this particular category where psychotherapy will not work at all. Here we need drastic medication. Sometimes even shock therapy is also needed in this particular category. Okay, so first we have to categorize whether the patient is healthy, whether the patient is neurotic, and whether the patient is psychotic. So based on that, we have to treat the patient. If the patient is in a normal individual, or he is in a healthy state, then we have to maintain his uh, healthiness. Okay, if you look into the Charaka Suprasthana, Indriyopakramani Adhyaya, there sorry, I don't have the slides. I could not share it. But thing is, in that particular context, in Charak Suprasthana 8th chapter 17th shloka, there Charaka has clearly mentioned that Tatra Indriyanam Samanaskanam Anupatattanam Anupatapaya. In the sense, to maintain the normalcy of these Indriyas, including Manas. Okay, what we have to follow is Prakriti Bhave Prayatitavyam Ebi Hetubihi Satmi Indriyartha Samyogina Buddhya Samyak Veksha Karmanam Samyak Pratipadanena Desha Kala Atma Guna Viparita Upasanena Cha Iti and Sadvritam Anushthem, etc. He has mentioned. Why I'm saying this particular quotation is because all these things, what is mentioned in this particular reference, these are the basis of psychotherapy itself. ABC psychotherapy, ABC of psychotherapy itself. A stands for analysis of the self or psychoanalysis. B stands for behavior therapy. C stands for cognitive behavior therapy. And D stands for the drugs. Okay. All these four categories can be understood by this main quotation itself. What Chakrapani says that Deshakalatma Guna Viparita Upasana analysis, there itself, it is nothing but analyzing the self, what in which position, what I am talking to, what is particular, this behavior is good for this particular situation, whom I am talking, what I am talking, whether it is correct or not, analyzing the self. Desha, Kala, Atma, orientation of place, time, and person. Orientation of time, place, person, and there also this has to be properly followed. Clearly, he has mentioned, and not only that, Satmi Indriyartha Samyogena. Satmi Indriyartha in the sense here specifically we can consider it as Mana Indriya. Okay, Mana Chintyam. So that has to be, you all know that Chintyam is considered as the main artha of Manas. Okay, so we have to follow Satmi Indriyartha Samyoga. We have to follow Satmi Indriyartha Samyoga in the sense, we know that Sattva Jayatagisa is nothing but Ahitebhyo Arthebhyo Mano Nigraha. There we have to induce the Hita Arthas. This has to be followed properly. And behavior therapy, Karmanam Samyak Pratipadanena iti Ahita Karma Parityagena Hita Karma Acharanena cha. Clearly he mentions that Ahita Karma Parityagena, which is not good for you, you have to avoid such actions and adopt such actions which are good for you. This is nothing but the behavior therapy itself. In the sense, whenever you know that this particular behavior or this particular action is not good for you, then whatever good for you, you have to understand, like that of relaxation. Okay, going for relaxation models, or else aversion therapy, modeling. Here, modeling does not refer to the modeling of what film stars and they do. It is role model. You have to follow the role models in the sense सभी के लिए एक रोल मॉडल रहता है, मतलब पापा हो सकते हैं या माँ हो सकते हैं, उनको देख के हम अपना
टाइम
बिहेवियर।
निरंजन जी, टाइम थोड़ा 3 मिनट।
ओके ओके
3 मिनट
ओके सर, ओके सर, ओके सर। तो कॉग्निटिव बिहेवियर थेरेपी भी इसमें हम समझ सकते हैं, इन द सेंस बुद्धिया सम्यगिदं मम हितम, कौन सा मेरे लिए अच्छा है, कौन सा अच्छा नहीं है, वो सभी समझ के हम ये कर सकते हैं। इसके अलावा प्रज्ञापराध हो, त्रिवर्ग अनुक्षण, ये सभी चीजें हमें अच्छे से फॉलो करना चाहिए। ये चीज सद्व्रत, ये सभी सद्व्रत फॉलो करना है। हेल्दी लाइफस्टाइल मॉडिफिकेशन, दिनचर्या प्रॉपरली फॉलो करना है। ठीक है, ये चीज उन लोगों के लिए है जो स्वास्थ्य मेंटेन करने के लिए है। ठीक है, एंड विकार प्रशमन के लिए स्पेसिफिकली सर ने ऑलरेडी बता दिया है, और मैं इसमें स्पेसिफिकली ये बोलना चाहूंगा, आहार औषध एंड आहार विहार एंड औषध। पर्टिकुलरली आहार के बारे में मैं बोलना चाहूंगा, वी हैव टू टेक सच आहार। ऑलरेडी प्रीवियस स्पीकर ने ऑलरेडी बोला है सात्विक डाइट यूज करना है करके, तो यहाँ पे मैं और ऐड करना चाहूंगा, वी हैव टू टेक the foods which are having tryptophan predominant or tryptophan rich foods, because this will increase the serotonin level in the body. Like हम dairy milk products हो सकता है, या sugar cane juice हो सकता है, या फिर नॉन वेजिटेरियन हो तो एग में अच्छा खासा रिच ये रहता है, ट्रिप्टोफैन रहता है। ये चीज हमको ये चीज खाने चाहिए जिसमें से सेरोटोनिन लेवल बढ़ता है। सेरोटोनिन लेवल जब बढ़ेगा तो दैट इज कॉल्ड एज हैप्पी हार्मोन। तो नॉर्मली माइंड को नॉर्मलाइज करने में वो हेल्प करता है। इसके अलावा विहार के बारे में भी मैं बोलना चाहूंगा। विहार में एक्सरसाइज करनी चाहिए। एक्सरसाइज करने से क्या होता है, एंडोर्फिन रिलीज होते हैं। एंडोर्फिन रिलीज होने से क्या होता है, दिस विल मेंटेन द ये करता है, मेंटेन करता है। ठीक है, एंडोर्फिन रिलीज होने से सेरोटोनिन लेवल भी वो मेंटेन करता है। या फिर आप प्रॉपर स्लीप करना चाहिए, नींद प्रॉपर से लेना चाहिए, ये सभी चीजें हमें करना चाहिए। एंड स्ट्रेस को कम करना चाहिए। ठीक है, और इसके अलावा बाकी सभी चीजें ऑलरेडी सर ने बता दिया है, तो और टाइम मिलेगा तो इसके बारे में और हम एक्सप्लेन करेंगे सर। ठीक है, आहार विहार के बारे में मैं स्ट्रेस देना चाह रहा था। ठीक है, कोई बात नहीं, और टाइम शॉर्टेज है तो इसलिए हम एक और बार और अच्छे से हम बोलेंगे सर।
कल
थैंक यू सर। कल मेरे लिए दिक्कत है सर, और 3 दिन के बाद हो सकता है सर।
ओके ओके ओके, थैंक यू। तो 3 दिन बाद ही रखेंगे मेंटल डे का। आप भी रहेंगे, धनंजय जी भी रहेंगे, डॉक्टर कार्तिकेयन जी भी रहेंगे, तीनों रहेंगे। मैं 3 दिन बाद ही करूंगा उनके,
जी सर,
केवल 2-3 स्पीकर रहे।
जी सर, जी सर।
थैंक यू। आज देखिए वर्ल्ड मेंटल हेल्थ डे था, और जिन जिन ने आशीर्वाद दिया उनको मैं सलाम करता हूँ, नमस्कार करता हूँ। इसीलिए हम लोगों ने आज मेंटल हेल्थ डे सेलिब्रेट किया। आप बहुत अच्छा बोलते हो निरंजन जी, बहुत अच्छा बोलते हो।
जी थैंक यू सर, थैंक यू सर।
थैंक यू। मैं अब डॉक्टर निशांत शुक्ला जी को और अगले स्पीकर्स को इस आग्रह के साथ बुलाना चाहता हूँ कि मैं आशा करता हूँ कि थ्योरी पूरी हो गई। अब यदि अपने वक्तव्य में से थ्योरी निकाल देंगे और प्रैक्टिकल एक्सपेक्ट, अपनी एडवाइस, लोगों के लिए सलाह, डॉक्टरों के लिए सलाह, ऐसा यदि कहेंगे तो ये उपकारी होगा। अभी भी 5 स्पीकर बाकी। थैंक यू।
परम श्रद्धेय अग्निहोत्री सर, परम श्रद्धेय पवन शर्मा जी, परम श्रद्धेय गुवाहाटी से शर्मा जी, उनको शत शत नमन। और उपस्थित सभी गणमान्य व्यक्तियों को नमन करते हुए, जैसा सर ने कहा उसी प्रकार से कुछ मैंने करने का ये विचार यहाँ पर रखा है। मैं अपनी स्लाइड शेयर कर रहा हूँ, एक ही सेकंड में। मैंने आज का टॉपिक रखा है वर्ल्ड मेंटल हेल्थ डे, कॉन्सेप्ट ऑफ व्याधित पुरुष. This is original concept given by Charak Samhita, and this is the most applied aspect when we are treating the patient and we come across the different conditions where the even the physical problems are there. The patient is suffering from the psychology, and managing those conditions, we need to first of all evaluate the condition. And today I would be trying to explain some of the bits how we can come to conclusion in a common medical ailment. हमारे टीचर कहा करते थे कॉन्स्टिपेशन की ट्रीटमेंट होती है, कॉन्स्टिपेशन का डायग्नोसिस नहीं होता है. एंड ही वाज क्वाइट करेक्ट इन हिज अप्रोच कि हम कॉन्स्टिपेशन की ट्रीटमेंट के लिए हजारों मेडिसिन देते हैं, बट कभी भी हम उसको जो है वो डायग्नोस जो है वो नहीं कर पाते हैं कि भाई उसको किस कारण से मोटिलिटी चेंज हुई, और मोटिलिटी चेंज होने का कारण कोई नर्व ब्लॉक है, साइकोलॉजी है, डायटेटिक इंडिस्क्रिशन है, या फिर उसको जो है ये मेटाबॉलिक प्रॉब्लम है. तो ये सभी चीजें को हम ट्रीट तो करते हैं पर उसका डायग्नोसिस जो है ये नहीं कर सकते. और उसी पहले मैं सिद्धांत को जो है इस व्याधित पुरुष के सिद्धांत को लेकर के किस प्रकार से हम इस पर विचार रख सकते हैं, उसके लिए मैंने कुछ जो है ये अपनी प्रस्तुतियां की है. और ये चिकित्सा में शायद सबसे ज्यादा उपयोगी है ये अप्रोच, तो उसको मैंने जो है ये लिया रखा है. कहीं से मेरी ये त्रुटि रह गई हो इस विषय से, कहीं मैं जो आज का विषय मेंटल हेल्थ का उससे कहीं मैं खींच काच गया हूँ, तो उसके लिए मैं सबसे क्षमा प्रार्थी हूँ. तो मुझे अगर मैं कहीं पर गलती करता तो मुझे मेरे गुरुजन जो है वो सुधारे, और मेरे मित्र वर्ग हैं वो मुझे योग्य सलाह दे ताकि अगले प्रस्तुतिकरण में उसको मैं ध्यान रख सकूं. व्याधित पुरुष का कॉन्सेप्ट जो है ये हमें 3 चीजों पर जो है ये डिसाइड करना पड़ता है, सत्व, बल और शरीर. ये 3 का जो है ये कॉम्बिनेशन इस प्रकार से है जो स्वस्थ का स्वास्थ्य बनाए रखने के लिए. और द सेम थिंग उसकी जब समूर्छना बनती है, दोष और दूष्य की जब समूर्छना बनती है, तो जो है ये व्याधि उत्पन्न होती है. तो दिस आर द 3 पिलर्स फॉर डायग्नोसिंग ऑफ द डिजीज. दिस प्रेजेंट्स द क्लिनिकल प्रेजेंटेशन. इसकी जो है ये स्पेसिफिक चेंजेस बॉडी में होती हैं, उसको हम साइंस कहते हैं, सिम्टम्स कहते हैं. और आज के दिनों में हमारे पास कुछ जो है इन्वेस्टिगेटरी मैकेनिज्म्स आ गई हैं, तो वी नीड टू ऐड द मार्कर्स इनटू द लिस्ट. लक्षण में हमें आज जो है ये मार्कर्स को भी जो है इंक्लूड कर लेना चाहिए. एंड दैट डिसाइड्स द सिवियरिटी. उसके आधार पर हमें जो है उसकी सिवियरिटी ऑफ द सिम्टम्स को हमें डिसाइड करना पड़ता है. बात करते हैं तो हम लक्षण पर केवल जो है वो ध्यान नहीं देते, केवल सिम्टम्स पर ये ध्यान नहीं देते हैं, उसकी समूर्छना पर हमें ज्यादा जो है ये केंद्रित होना पड़ता है. कल मैंने एक अपने विचार में रखा था, तमक श्वास की चिकित्सा में हम लोग पढ़ाते हैं, तमक श्वास में विरेचन जो है ये करवाते हैं. जब हम वाग्भट को पढ़ते हैं तो वाग्भट में बताया कि भाई कफ के लिए सबसे श्रेष्ठ उपाय है वो वमन है. पर फिर भी जब हम तमक श्वास की बात करते हैं और चरक को हम पढ़ते हैं, तो चरक ने केवल और केवल जो है ये विरेचन की बात बताई है जब उसको जो है वो लॉन्ग टर्म रिलीफ की करना हो. उसी प्रकार से पक्षाघात विरेचनम, पक्षाघात वात व्याधि है, उसमें बस्ती जो है वो श्रेष्ठ चिकित्सा होते हुए भी जब हम चिकित्सा की बात करते हैं तो वहां पर जो है ये विरेचन आ गया. तो इसका आधार लक्षण नहीं है, दोष जो है ये नहीं है, केवल उनकी समूर्छना है, उसके आधार पर ये रहती है. और दोष दूष्य समूर्छना जनित व्याधि, ये व्याधि की परिभाषा है. व्याधि जो है वो हो रही है वो दोष और दूष्य की समूर्छना, किस प्रकार से उनका एमल्गमेशन हो रहा है, किस अंश से, अंशांश कल्पना से ये व्याधि उत्पन्न हुई है, और उसको अंशांश कल्पना को किस प्रकार से तोड़ा जाए ये हमें ये डिसाइड करना पड़ेगा. और व्याधित रूपीय जब हम देखते हैं तो वहां पर भी जो है ये हमें ध्यान व्याधि की अवस्था को और समूर्छना को ये देखना होगा, ना कि व्याधि के लक्षण को। सामान्य रूप से ये देखा गया है कि जो एंग्शियस पर्सन्स होते हैं, डिप्रेशन साइकोटिक पर्सन्स होते हैं, उनको जो है जितनी भी प्रॉब्लम होते हैं वो उनको बढ़ा चढ़ा करके सत्व कम है, शरीर बल कम है, तो वहां पर लक्षण जो है वो ज्यादा दिखते हैं, रोग जो है वो गंभीर नहीं होते हैं। और केवल उनके लक्षण को या फिर उनकी फरियाद को देख करके हम अगर ट्रीटमेंट करने बैठे हैं तो कहीं ना कहीं हम गलती कर जाएंगे। तो हमें उसमें सौम्य औषधों का ही प्रयोग करना चाहिए। मैं अपने बच्चों को एक एग्जांपल हमेशा देता हूं एब्डोमिनल पेन के बारे में, और अप्रोक्सीमेटली 50 to 60% पेशेंट जो है ये फैंटम पेन का लेकर के आते हैं। क्रॉनिक डल पेन में जो है ये काफी एक कॉमन प्रेजेंटेशन रहता है फैंटम पेन का, या फिर क्रॉनिक एब्डोमिनल डलनेस। और वहां पर जो है वो एक्यूट पेन के जो कैरेक्टरिस्टिक फीचर्स जो है रहते हैं, कॉलिक की पेन में कितना भी पेशेंट कर ले वो सीधा नहीं बैठ सकता, उसको जो है वो घुटने मोड़ करके ही उसको बैठना पड़ेगा, तभी उसको जो है वो रिलैक्स फील होगा, तभी उसके जो है वो रेक्टस थोड़ा जो है वो रिलैक्स होंगे और उसको जो है वो पेन में रिलीफ मिलेगी। जबकि एब्डोमिनल पेन का वही एरिया है, क्रॉनिक कोलाइटिस का पेशेंट है, पेशेंट जो है वो इतनी जो है वो मुंह बिगाड़ेगा, पेन स्कोर जब हम देखते हैं फेशियल पेन स्कोर तो वो जो है वो ज्यादा होगा, पर एब्डोमिनल एग्जामिनेशन जब हम करने जाएंगे तो वहां पर जो है वो मार्क टेंडरनेस की जगह पर मिनिमल टेंडरनेस या नो टेंडरनेस हमको जो है ये देखने को मिलेगी। तो हमें ये डिसाइड करना पड़ेगा कि समूर्छना क्या बन रही है और वो समूर्छना किस अवस्था तक है उसको हमें डिसाइड करना पड़ेगा, और उसी के आधार पर हमें उसकी ट्रीटमेंट करनी पड़ेगी। तो सत्वतः परीक्षित, जब हम दशविध परीक्षा की करते हैं, प्रकृति विकृति सार सम्मनन, और उसमें जो है वो सत्व की बात करते हैं, तो सत्व के आधार पर व्याधि के लक्षणों में परिवर्तन जो है ये देखने को मिलता है, वो तरतम भाव जो है वो उसमें देखने को मिलता है, और उसका जो है ये हमें डिसाइड करना पड़ेगा बाकी के लक्षणों के आधार पर, और उसके आधार पर हमें ट्रीटमेंट करनी पड़ेगी। तो ये सभी जो है जो मैंने जो आपको बताई वो इसकी स्लाइड्स में, आई एम जस्ट कीपिंग जो मुझे बात करनी है। तो ये हैबिचुअल कॉन्स्टिपेशन की जो मैं बात कर रहा था, सर ने बात की कि भाई प्रैक्टिकली कुछ बात करो, तो यहाँ पर मैंने कुछ जो है ये अपने विचार इस प्रकार से प्रस्तुत करने चाहे हैं। तो हैबिचुअल कॉन्स्टिपेशन ये काफी कॉमन प्रॉब्लम है, और ऑल ओवर इंडिया में हमें सौराष्ट्र में तो ये काफी हद तक ये दिखाई देता है, और पेशेंट जो है ये अलग अलग फॉर्म की कंप्लेंट्स लेकर के आते हैं, और वे सिंपली प्रिस्क्राइब हरितकी चूर्ण, हरितकी से फर्क नहीं पड़ा तो फिर जो है वो त्रिफला दे देते हैं, त्रिफला से फर्क नहीं पड़ा तो फिर त्रिवृत दे देते हैं, त्रिवृत से फिर फर्क नहीं पड़ा तो मिंडियावड़ दे देते हैं, उससे फिर फर्क नहीं पड़ा तो फिर जो है ये आगे की हम जो है वो चलते रहते हैं, फिर बस्ती दे देते हैं, पर पेशेंट को जो है ये रिलीफ नहीं होता है। पेशेंट क्रॉनिक कोलाइटिस का है, उसको भी जो है ये कॉन्स्टिपेशन की प्रेजेंटेशन होगी, हृदय भी अकृत संज्ञा उसमें देखा जाएगा, और स्काइबेला मास्टूल जो अनाह में है, जहां पर वातानाह और पुरुषानाह में है, जहां पर मल जो है वो परिपिंडित हो जाता है, तो ये दोनों कंडीशन को हम एक ही तरह से वो ट्रीट नहीं कर सकेंगे। तो वी नीड टू हैव द क्वेश्चनर, और उसको किस प्रकार से डिजाइन किया जा सकता है उसको मैंने यहाँ पर जो है ये लिखा है, और उसकी प्रोबेबल मैनेजमेंट भी यहाँ पर लिखी है। तो पहला जो है ये अनाह के रूप में जब ये होता है, स्काइबेला मास टूल जब होता है, तो यहाँ पर जो है वो हम परगेटिव्स का यूज करते हैं, त्रिवृत सुख विरेचना नाम श्रेष्ठ, या फिर आरग्वद मृदु विरेचना नाम श्रेष्ठ, यहाँ से हमें जो है ये देना पड़ेगा। In my practice, I am not using Trifla as much. Instead of that one, if the patient is complaining of this bowel disturbance, और उसके साथ उसको जो है वो bowel hard हो रहे हैं, then I am prescribing them the Aragvad, and when it is continued for a longer period of time, it regulates the bowel movement for a longer period of time, और उसकी drug dependency जो है ये कम होती हुई देखी जाती है। उसी प्रकार से इसको जो है वो मेगाकोलन में भी यूज कर सकते हैं। तो ये मेगाकोलन में भी यही कंडीशन होती है, बल्क में जो है वो स्टूल पास होगा, फिर रुक जाएगा, फिर बल्क में स्टूल पास होगा। ये दिस इज कॉन्जेनिटल डिफॉर्मिटी और लॉन्ग टर्म उसको रिलीफ के लिए वन में रिक्वायर दी प्रोलॉन्ग 5 या 6 साल तक उसको ट्रीटमेंट दे करके उसमें रिलीफ जो है ये रेगुलेशन थोड़ा जो है 70-80% तक उसको रेगुलेट किया जा सकता है। तो ये फर्स्ट कंडीशन होती है जिसको हमें डिसाइड करना पड़ेगा। आगे के पिक्चर्स में मैंने ये लिए, मैं आगे जो है ये बात करूंगा उसकी, उसको मैंने पिक्चर्स के साथ भी मैंने ये समझाने का प्रयत्न किया। सेकंड वन जो कॉन्स्टिपेशन में ये होता देखा गया और ये साइकोलॉजी इसमें सबसे ज्यादा प्ले करती है, द फीलिंग ऑफ इनकम्प्लीट या फिर रिपीट इवैक्यूएशन। पेशेंट को एक बार जा करके आया फिर जो है उसको जो है ये सेंसेशन होती है और ये मोस्टली जो है वो साइकोलॉजिकल होती है। इसमें बॉडी फंक्शंस जो है ये डिस्टर्ब नहीं होते। द पेशेंट स्टार्ट थिंकिंग ऑफ दिस वन एंड दिस थिंकिंग लीड्स टू द सम फॉर्म ऑफ नर्वस डायरिया। यहाँ पर वेल फॉर्म्ड ही होता है, स्टूल हार्ड भी नहीं होता है, इवैक्यूएशन में प्रॉब्लम नहीं होता है, बट देयर इज ऑलवेज अ सेंसेशन। तो यहाँ पर जो है वो ट्रीटमेंट हमें मेडिसिनल ट्रीटमेंट की जगह पर उसको लेवल को हमें जो है वो करेक्ट करना पड़ेगा। इफ वी आर यूजिंग द मेडिसिन इन दिस कंडीशन वी आर एक्चुअली हार्मिंग द पेशेंट और उसको जो है ये फैंटम ट्यूमर या फिर ट्यूमर पैथोलॉजी में हम जो है उसको जो है वो शिफ्ट कर रहे होंगे। तो जिस प्रकार से गुल्मों में बताया है यथा कर्षण एव कर्षितस्य उसको और उसको जो हम फिर से कर्षण औषधियां दे रहे हैं, रेचन वगैरह दे रहे हैं, तो इसको जो है वो दिक्कत हम बढ़ा रहे हैं, उसको जो है वो प्रॉब्लम को हम उसकी प्रॉब्लम को ठीक करने के बजाय उसको लॉन्ग टर्म डैमेज हम ये कर रहे हैं। और जो गैस्ट्रिक मोटिलिटी है वो ओवर पीरियड ऑफ टाइम दैट वुड अफेक्ट। The next one is increased timing. The patient needs more time. तो यहाँ जो है ये behavioral changes का एक अपना जो है ये अप्रोच रहता है और this behavioral change, lifestyle changes, that is the most appropriate treatment. We need to diagnose this condition. Next one is the sticky stool. ये commonly जो है ये आफ्टर कोलाइटिस देखने को मिलता है या फिर ड्यूरिंग द कोलाइटिस इरिटेबल बोवेल सिंड्रोम में या फिर जिनको स्टेरॉइड्स वगैरह चल रही हो और अल्सरेटिव कोलाइटिस का हो, प्रोक्टाइटिस का हो, पानकोलाइटिस का हो, तो उसमें जो है ये कंडीशन देखने को मिलती है कि पेशेंट हैज टू पास द स्टिकी स्टूल्स। और इन कंडीशन में डाइट रेगुलेशंस के साथ साथ इंस्टेड ऑफ गिविंग दी परगेटिव्स यहाँ पर या तो जो है वो डाइजेस्टिव का यूज किया जाए या फिर कोटेज वगैरह का यूज किया जाए। लॉन्ग टर्म यूज डाइजेस्टिव और कोटेज दोनों को साथ साथ में एंटी डिसेंट्रियल मेडिसिन को यूज करके हम उसमें जो है ये ज्यादा बेनिफिट उनको जो है ये दे सकते हैं। हमारे पास आने वाले कॉन्स्टिपेशन में से करीब करीब 30 से 35% केसेस ऐसे होते हैं जिनको डायग्नोसिस जो है ये क्रॉनिक कोलाइटिस जो है ये होता है, ना कि कॉन्स्टिपेशन होता है। पेशेंट भले कॉन्स्टिपेशन की फरियाद करता हो। नेक्स्ट वन इज द म्यूकस स्टूल्स, स्टूल इन द म्यूकस, आंव के साथ जो है ये स्टूल आता है और ऐसी कंडीशन में द एंटी डिसेंट्रियल इज द select it is a good medicine. Instead of using haritaki we can go with a long term use of kutaj, shankpati, sanjeevani that regulates the bowel. And lastly the repeated evacuation, already I have discussed. So all this thing I have just tried to summarize. जो मैंने कहा उसको स्टूल फोम्स के साथ किस प्रकार से ये कर सकते हैं, जैसे मैंने पहले कहा था स्काइबेल। सर एक ही सेकंड में मैं खत्म कर रहा हूँ, 1 मिनट में केवल। तो फर्स्ट वन इज सेपरेट हार्ड लम्प स्टूल, दिस इज द अनाह, द सॉसेज शेप बट लंपी स्थूल स्टूल, और ये जो है ये मेगाकोलन वगैरह में मिलता है। लास्ट वन लाइक सॉसेज बट द क्रैक ऑन द सरफेस, वात प्रदान, यहाँ पर वात की चिकित्सा जो है और थोड़ा थोड़ा जो है वो स्नेह के साथ हमें ये देना चाहिए। लाइक सॉसेज और स्नेक स्मूथ सॉफ्ट, दिस इज वन फॉर्म ऑफ द प्राकृत मल। सॉफ्ट बल्ब्स, क्लियर कट एजेस, मलभेद या फिर प्रवाहिका, pieces of rugged edges, meshy stools, this is in the pravahika. And lastly watery stools, atisar. Same slide. Constipation is treated but seldomly diagnosed. Thank you very much. मैंने कहीं पर क्षति की हो तो मैं उसके लिए क्षमा प्रार्थी हूँ। पर ये एक मैंने प्रयत्न किया कि किस प्रकार से हम थोड़ी रैशनैलिटी जो है ये डेवलप कर सके ऑन द बेसिस ऑफ द स्टूल पिक्चर. थैंक यू वेरी मच सर.
Thank you very much, Dr. Nishanji. Now I would like to invite Sutpa Vardhanji. Welcome, Sutpa ji. Welcome. Madam Sutpa.
Yeah, thank you very much.
Yes.
Am I audible?
Yes, clear.
Okay, so I would like to share my screen. Is that okay? So can I take over the screen?
Sure, sure.
So I'm actually very excited to be a part of this particular session. And thank you each one and every one of you to make me a person here to speak. And I'm not only excited to speak, but I was equally excited to hear so many professionals and so many learned persons who has enlightened us on the World Mental Health Day. So I'll not talk much because I think we are running time and we have more guest speakers to talk on this. So World Mental Health Day is celebrated, we know, like from a very long time. And this year, the mental health theme is a universal human right. So let us understand what do we mean by mental health. Like we have all known that mental health is something which is very critical. And we have seen like how mental health is important for caregivers, how mental health is important for each one of us. But at the same time, it is very, very important to understand that each one has equal right to have this mental health for us. Mental health, what it does is not only keeps us healthy, but also keeps us happy. And we all know we can keep ourselves happy if and only if we are mentally happy. So the overall objective of the Mental Health Day this year is to raise the awareness of the mental health issues around us and also understand that it is not only equality, but also equity we have in the system. So, and this day also provides us an opportunity to understand and talk about the needs, the requirement, and every time a mental health care every person needs. So if we actually talk of mental health, so when we see that when we need mental health, so this year, as we see that the theme has been that of the human rights. So I'll not go into detail. So there has been a lot of other themes around mental health of all these years. So we see that there are themes that was around women and mental health, children and mental health, also depression as mental health. So we can understand while it started from year 1994 till almost 2023, we have different themes to work upon. And this is how we have been celebrating the Mental Health Day. So one more very important thing, what we say, like, what do we mean by mental health? Mental health is something to keep us happy mentally, psychologically, and emotionally. And while we have been talking of so many great speakers who have been talking with respect to Ayurveda, I am a mental health professional from a NGO point of view, and I have been talking to many people and across the strata, across age group, and across different possibilities of people having different mental situations. Mental health, like not only enriches us if we are healthy, but at the same time it also enriches the environment where we stay. So it's very important that when we talk of mental health, we not only talk of mental health, but we also talk of mental health and well-being. So here, when we talk of well-being, what are the areas we can talk of well-being? We talk of well-being around relationships. So we all know, like we have a healthy relationship in our family, we have healthy relationship in our family, in our work life, we have healthy relationship with our neighbors, we have healthy relationship with everybody we meet day in and day out. So that relationship obviously keeps the wheel of well-being going round and round. Exercise, happiness, exercise, yoga, meditation is something which surely keeps us happy, and I think this needs no more further detailing. Recreation is something which keeps us happy. We all know, like recreation, secretes the happy hormones for which we make ourselves happy, and in that process we keep ourselves mentally happy, and of course we take care of our mental health. Similarly with recreation, as we see, like we also have the relaxation. So it's not only work, all work and no play makes Jack a dull boy. So similarly, all the things which we do, it's very, very important that we have a relaxation schedule for ourselves. Spirituality is very, very important. So the philosophy of life, how we deal with others, and how we see ourselves when we stand in front of the mirror. Am I happy today? What is the condition of my mental health today? So that is very, very important when we try to connect with the spirituality. Nutrition, good food, simple food, humble living, we all know is also another point which keeps the wheel of well-being going round, and of course, taking care of our mental health. Nature, when we look around, when we see the biodiversity, the ecosystem, the nature around us, that surely keeps us very happy, and that makes us very, very, like wanted and close to nature, and that also makes us very, very happy in terms of our mental health. Finally, when we give back something, like how we have seen today in our session, we have so many good speakers who came and enlightened us. So this give back to each one, this give back to the society, this give back to the family really keeps us very happy and nurtures the well-being aspect of our mental health. So while we also take this, we see like what happens when this mental health is not balanced. So we see the power of positivity which comes in. Like, of course, I'll talk about what happens if the mental health is not balanced. So we just talked, I think few of our speakers also talked on that. So while we talk on the mental health part, the positivity, the well-being part, we see that all that we need to do is think positive. And what we know, our brain, our mind is the place which directs us to do what we do. Our behavior manifestation, our happiness factor, our sorrow, everything, every aspect that gets controlled by the brain. So what is the medicine the brain can get? The best medicine the brain can get on a mental health aspect is if we think positive. So what we do, we are happy, we are harmonious, we are strong, we are gorgeous. So all these are happiness factors and some keywords which makes us feel happy, gives us positivity, and surely all these things brings in a lot of mental health aspects in our mind. Finally, just as we were talking, so what do we understand like when we are not in the right state of mental health? So we all know like we have what we call stress, and we all need to avoid this stress. The more happy we are, the more we take care of these mental health, we will see that all these things which are part and parcel of our day-to-day lives, which comes to us in the form of mental agony, if we are not mentally happy, will obviously be not there for us. Finally, as we say, like what do we need to do to make ourselves happy, to keep ourselves mentally not challenged? So we have to connect like how we are doing today. We have to, like more and more connectivity we have, more and more activity we have. Like we were talking of autism. Another very big challenge which we have in the society now, which impacts mental health, is dementia and Alzheimer. So what is the best medicine for dementia and Alzheimer? We are saying, we know it's a neurological disease. We cannot cure it. But what can be done as far as Alzheimer dementia is concerned? The connectivity has to be there, the coordination. So the more the communication is there, verbal communication, social communication, mental communication. So this connectivity is very, very important. And what can be done is to keep connected, keep connections within your family, keep connections within your friend, give back to the society. So that becomes a very, very important aspects when we talk of mental health. We have to be active. So activity, just like how I quoted in case of dementia, it is social activity, it is psychological activity, and it is physical activity. So all these three activities married together keeps us active, and of course gives us the mental well-being and the positivity which leads to the mental health. Then we take out a bit of time for yourself, notice things around, make yourself aware. So this awareness will obviously keep yourself one step ahead than many others who might be needing your help. So you as a mental health professional, we as mental health professional, we need to be very, very much aware of our surroundings. Keep learning so we can understand. Like I've been attending a lot of IRES sessions, and trust me, every time I am carrying something, a feather in my hat. So learning is something very, very important. It is not only important to make ourselves enlightened, but at the same time, it is important that we keep pace with our current days. So it's not only earning the learning, but at the same time, if we can share what we have learned, keeps us really going. And finally, as we said, like in terms of the learning part, we have to give. It is a very, very big opportunity when we give. Giving makes a person very, very happy, feel satisfied that yes, I have been able to do something for someone. You smile, you give a smile. You give happiness to somebody, the person feels happy. So these are areas where we really want to understand that we have to keep all of us happy, each one of us happy, and these will be the key to open the lock for the mental well-being. And finally, today, as we know, like the theme of the day is mental health awareness as well as understanding one's own human right. So these are the key points. Good mental health is an integral part of our overall wealth and well-being. Mental health is a universal human right. So yes, just like one of our speakers, leading speakers said, mental health is a human right. This is not only a privilege, but a right. We all need to know, we all need to understand what is our right, and this is our right. So we need to claim for it. Everyone has a right to access the quality mental health care. So everyone in the family, in the society, whatever position they might be working, they have the right to access a quality mental health care. Mental health conditions are very, very significant threat to well-being of young people. So we know like how in the life's development cycle, when a child is going into an adolescence, we do have a lot of stresses that are coming into their ways. So there are significant challenges which are coming not only to young people, to adolescents, to teens, and also to adults. And yes, as we know, like as we go into late adulthood, the fact that even people accepting their old age is also causing a lot of mental health agony. We must challenge the stigma and discrimination surrounding mental health. So this stigma and discrimination, I think we talked around autism. So I've been also working very, very closely as a special educator with autistic children. And the stigma which each parent and each caregiver has is extremely delicate. And I agree and I can feel that every parent, never acknowledges. And it is so difficult for them to acknowledge that my child is having autistic traits. Forget about having autism as a disorder, but even the mere thought that my child is having autistic traits is sometimes becoming very, very challenging. And this is because the stigma that is there in the society. We all have the right to live independently and be included in the community. So I think we have all talked about inclusive society. We have all talked about a society where we need to be a part of the mainstream, but are we able to do that? So this is one very key area we need to highlight and not only be aware of it, but practice it and try to spread the independence and the inclusion in the society, be it in any area, whether you yourself be a mental health patient or you be a caregiver of your mental health person with whom you're giving care. Good quality communication mental health services supports are very, very crucial. I think the awareness are increasing. We have psychiatrists, we have psychologists, we have counselors, we have caregivers, and we have a lot of care that are coming in, and that's how we are much more supportive to our society. Finally, recognizing mental health as a human right will empower each and every one of us. So as the main theme of this year's mental health is human right, it is very, very important that we understand our right. Just that when we vote, we understand our right, understanding that we have the right to have mental health and mental peace is a very, very important aspect we should be all taking care. And finally, you might know your mind, but do you know your rights? So every person's mind is wonderful, complex, but rights should be the same. And finally, I would want to end this with the thought that mind is everything. So reflection of the mind is very, very important. So we should be in the right mental state and the right mental health state so that we can change our mind. And while we change our mind, we can change everything and everyone. Thank you very much once again. It was a delightful session and looking forward to attend more IU session. Thank you.
Thank you. Thank you very much, madam. Nicely explained. You have nicely explained the situation and the circumstances in autism. Excellent. Great, madam. Please do join whenever the topic of your choice will be there. Please do join.
Thank you.
Thank you. Now I would like to request Dr. Leena Gehani ji. Welcome, Dr. Leena Gehani ji.
Thank you, sir. Thank you so much. It was indeed a
Welcome.
great pleasure to hear. It was indeed a great pleasure to hear all the speakers, about mental health. So I want to share my screen. I hope my screen is visible. Hello, is my screen visible?
Yes, yes, of course.
Okay. Mental health is not just the absence of mental disorder. It is defined as a state of
आपकी आवाज आनी बंद हो गई है। नेट की प्रॉब्लम।
Your voice is not coming, Doctor. अग्निहोत्री सर थोड़ा देखिए ना।
जी डॉक्टर लीना आप
अग्निहोत्री सर देखिए ना थोड़ा।
जी डॉक्टर लीना आपकी आवाज नहीं आ रही है। हाँ जी आपकी आवाज नहीं आ रही है। आप अगर स्लाइड का नहीं सिस्टम संग चल पा रहा है तो आप ओरली अपना कंटिन्यू करिए। डॉक्टर लीना अभी ज्वाइन ऑफ की बैठे ऑफ टू अनम्यूट यस। डॉक्टर लीना आपका कनेक्शन ऑफ हो गया है।
आप एक बार फोन करके बोल दीजिए ना सर प्लीज।
अच्छा अच्छा मैंने आस्क टू स्टार्ट वीडियो आस्क टू हाँ देखता हूँ। स्लाइड तो आ रहे हैं।
Hello. Am I audible, sir?
Continue, you are audible, yes. Visible also, yes. Please continue.
Oh, thank you, sir. Were my previous slides visible and I was audible?
Yes, you are audible, yes, of course.
Shall I start over again, sir?
Yes, please just save time. You were strict at your first slide. Since then, your voice was gone.
Okay. I'm so sorry. Sorry, sir. Certainly, sir.
I think it's again the same. You please continue orally. Extempore, you can continue.
No
your talk.
problem. PPT also can be presented fast, but fast.
No, the moment she starts, it makes a
Yes,
discontinuation.
You can start by oral
Sir,
also.
sir, can you hear me, sir?
Yes, very clear. But your
Okay.
mobile is
So,
not popular.
Hello.
Yes, your computer presentation is not cooperating. I think the moment you start showing video, it stops. The white stops coming. So you can continue extempo, or even on off video, you can continue. Yeah.
Okay. So.
Is it technical glitch?
Yeah. So, techno stress is one of the major why many of the mentally because what and even not sleeping on mobile phones जब तक मोबाइल फोन का स्क्रीन नहीं देख लेते तब तक बहुत लोगों को नींद नहीं आती and then relationship stress is also one of the reason the conflict in the relationship there are no patience in human being nowadays or adaptability is one major unadaptability is one of the major factor contributing towards the and then one of another major that we can see of mental illness is inferiority complex also nowadays complex because a lot of
Please unmute.
Hello, sir. I guess technically,
Yeah.
there's some technical fault, sir. I guess.
Repeatedly, it happens in your case. You can shift your site where the strong signals are available. It may be any room or outside room or wherever. You can select before starting where the place the strongest signals are there. Actually, what I think that at international platform, it needs at least 40 Mbps speed to present. You start speaking whether the slides are there or not. It's making a gap. By now, you have pointed out so many things regarding the causes of the mental, illness. You pointed out regarding the obsession over the regarding the mobile screen before to sleep. Observe the mobile screen before the sleep. Also, you talked about the relationship disturbances. Also, the say unadaptability, and the fourth one is the inferiority complex. These 4 points you pointed out, these may lead to the major cause as a major cause of the mental disorder.
कमेंट बाद में कर लेंगे. Now I would like to request Dr. Kirti. अभी भी 2 स्पीकर बाकी है और नेक्स्ट वेबिनार बाकी है.
नमस्ते सर.
नमस्कार मैडम.
नमस्ते.
प्लीज अग्निहोत्र के बारे में कुछ समझाइए.
जी सर.
जिससे हम और अग्निहोत्री जी दोनों ही कृतज्ञ हो सके.
नहीं, आपने एक मजेदार बात देखी, डॉक्टर श्याम सुंदर साहब ने क्या किया कि जब कीर्ति जी अग्निहोत्री कर गई तो हम शर्मा हो गए. ये नहीं, आप तो सुनते रहे हो तो एक एक शब्द का देखा. अब तो कीर्ति जी अग्निहोत्री हो गई और हम शर्मा वाली टीम में शामिल हो गए. सर्वे ब्राह्मणा शर्मा संति.
एक्चुअली पीएन राव सर ने हमारा सरनेम अग्निहोत्री कर दिया है. जब भी मिलते हैं सर बोलते हैं अग्निहोत्री मैडम आप कैसे हो.
क्या बात.
दो हो गए.
जी सर. अभी हम देखेंगे जैसे आपने हवन किया था हमने उसी के दौर में अग्निहोत्र के बारे में बोलूंगी. ये अग्निहोत्र की जो प्रोसीजर है अक्कलकोट स्थित परम सदगुरु श्री गजानन महाराज उन्होंने बताई है. आपने देखा होगा बहुत जगह पे बहुत सारे तरह के यज्ञ होते हैं, होम होते हैं, हवन होते हैं. कुछ लोगों के घरों में 24 घंटे अग्निहोत्र रहता है. बट जैसे जैसे समय चलता गया लोगों के जीवन शैली में बदल आ गया. सब चीजों की वजह से वो सब पीछे होता गया. तो लाइक पीपल स्टॉप डूइंग ऑल these rituals. So Param Sadguru Shri Gajanan Maharaj has taken the vow to rejuvenate the Vedas, and he has given this very simple form of yajna which is called as Agnihotra. This can be performed by anyone. There is no bar for any social status, then caste, creed, or gender. No restrictions are there. And this Agnihotra is performed at the local sunrise and sunset time with few small technical disciplines. We can say there are 5 disciplines. First one is the time. We have to be very strict following the local sunrise and sunset timings. As we all know, so sunrise and sunset timings, they are very important in our body. They are having the major shift in the energy levels. हमारा इडा पिंगला नाड़ी जो है they change at that time, and there is major shift in the breathing pattern as well. There is major shift in the bacterial growth in the universe also. The second discipline is the special vessel, copper vessel, which is of semi-pyramid shape. And this vessel is having a particular thing that it is exactly opposite of the pyramids which we see in Egypt. So where they are having the job of preservation of energy, here this pyramid pot will help us in diversifying the energy, spread the energy. So whatever we are burning inside that copper vessel will be going out. Then the third one is the cow dung cakes, which we will be using. Cow dung cakes or the dung from the any cow family will be can be useful. And we all know, being Ayurveda doctors, the medicinal properties of cow dung, antibacterial properties are there. Then the fourth one is the offerings. We are using whole grain uncooked rice smeared with cow's ghee. We will be giving 2 offerings in the morning and 2 offerings in the evening. And the fifth and last important discipline is the mantras. In the morning, we will be saying Suryaya Swaha, Suryaya Idam Namama, Prajapataye Swaha, Prajapataye Idam Namama. In the evening, we will be saying Agnaye Swaha, Agnaye Idam Namama, Prajapataye Swaha, Prajapataye Idam Namama. So this is the process of Agnihotra. After the performance of Agnihotra, one can chant any shlokas, can meditate, can do yoga, can do any other work, or can straight away just do whatever work they are doing. Like they can travel, they can do household work or anything. There is no restriction as such, while performing the Agnihotra. A very simple technique, just takes 5 minutes. As you have seen, I have arranged the cow dung cakes in that pot, and it takes hardly 5 minutes to burn fire without smoke. The fire should be smokeless. And then we will be giving 2 offerings. Once the offerings are given, only once we are supposed to give. One person has to give the offering. Other people can attend it. There can be many people in the house if all of them want to perform Agnihotra. Only thing is they just need to, take another patra and they have to perform the Agnihotra. But in one pyramid, they have to, only one person has to give the offerings. After that, we all know what is the effect of Agnihotra. We know that Sayam Grahapatirno Agni Prata Prata Saumanas Sadata Prata Prata Grahapatirno Agni Sayam Saumanas Sadata. So Agnihotra performed in the morning will give us the Saumanas or tranquility till the evening. Agnihotra performed in the evening will continue that tranquility till the next day morning. So that way we have been given the 24 hours cover over here, and the whole atmosphere in the house, in the surroundings will be charged up. You can see the difference in the atmosphere where they're performing Agnihotra regularly and the other places. This Agnihotra smoke, it has got medicinal properties, and that is reaching to our brain directly. We all know the concept of Dhumanasya, that it has direct action. It acts on our sense organs. Same way, this, whatever we are burning in this pot, that is cow dung along with the ghee at that exact sunrise and sunset timing, will have the tranquilizing effect over the mind. We have done researches at many places. Few of those I would like to quote. One was done at Delhi in the military hospital for the a smack addicted person. Then there are few more researches done in the DRDO and army hospitals in various places, and they are all done for the depression, anxiety, and the various kind of addictions, and we have got very good results. We have taken some readings at various places where small children are involved, and those kids are hyperactive. So for them also we have got very good results. Then we are, still hoping to do a lot much of research in Agnihotra in the field of, the effect of Agnihotra on the mind. And as everyone has been talking about the various types of the chikitsas like Sattva-Vajay, I would say that Agnihotra will, work as all three, Daiva Vyapashraya, Yukti Vyapashraya, as well as Sattva-Vajay. Daiva Vyapashraya, it has straight away told that Homa is a type of Daiva Vyapashraya chikitsa. Sattva-Vajay also, it helps in enhancing the positivity in the person's mind. And the Agnihotra ash, what we are using, will have the medicinal effect. We have used it in the form of cough syrup for the skin disorders, and the pH of water changes to the alkaline. Just recently, yesterday only, we have got few results. We have been performing some experiments where Agnihotra ash has helped us to change the pH of RO water to the alkaline level. And lastly, I would like to request all present over here to help us, to guide us to go ahead with the researches. We want to do the research, in the with major sample size. These researches, whatever have been done, they have been on a pilot base. And like as everyone knows, this is Aptopadesha. We have to perform yajnas, we have to perform Agnihotra. But still, in the present era, we feel that we need some kind of results with us, so that we can urge the people to perform Agnihotra daily. And maybe some other time, if sir permits, we can see the demo also. Due to the shortage of time, I think it may not be possible. But the same way, whatever I have performed, lit the fire, in that only we have to give the 2 offerings. Here we have to make sure we are using only cow dung cakes, whole grain uncooked rice smeared with cow's ghee, the timings, and the pyramid shaped pot. We are not supposed to burn any other samidha or any other offerings in that, because that will be called as different form of homa or yajna. And the mantras also need to be these only. So whatever results I have just now told, whatever effects we have got, this has, with this procedure only, we have got the results. And I would like to thank Pawan Kumar sir, Agnihotri sir, for giving me the opportunity to share my thoughts. Thank you very much, sir. Namaste.
Thank you, Dr. Kirti. I would like to take your 30 seconds only. This is your pyramid shaped
Yes.
Kund, right?
Yes, yes.
And again, what we are talking about, this is this. Now see and surprise, I am in Haridwar and you are Kolkata. See, is it? I got it way back in 1995 from Kolkata, and it was performed in front of us. At he gave me the chart of a whole year of sunset and sunrise at every altitude. And this is what you are talking about, Shivpuri?
Yes, sir. That's right.
These are the mantras. I've got such a great collection. See, this is the same book you are talking about.
Yes, sir. Yes, sir. We are
I'm not simply said to be Agnihotri. I stand for that, and this is your booklet.
Oh yes, Shivapuri. That's right, sir.
Great. Thank you.
Shivapuri,
Thank you very much.
Only change has been that, sir.
आप जहाँ कहीं से लेके आते हैं और यहाँ उसका हम लिंक जोड़ देते हैं, देखिए कमाल। और आधे सेकंड से अपनी लाइब्रेरी से निकालना है और ये तो पूजा में रखे रहता है। 90 रुपीज वो खरीदा तो मैंने 1995 में।
सर अभी थोड़ा चेंजेस हुआ है, प्राइस में चेंज हुआ है।
क्यों नहीं? कॉपर इज कॉस्टली, कॉपर इज अ कॉस्टली मेटल। It might have gone to 250, I think.
मेडिसिनल इफेक्ट तो सभी लोग जानते हैं, इसीलिए मैंने ज्यादा उसके बारे में बात नहीं की, क्योंकि सभी आयुर्वेदिक डॉक्टर्स हैं। एंड वी हैव गॉट एन ऐप नाउ, विश्वा ऐप इज देयर, विश्वा अग्निहोत्रा, जिससे आप दुनिया में कहीं पे भी हो, आपको सनराइज सनसेट टाइम मिल जाएगा।
Now I would like to request Dr. Sakat Vasu from Ontario, Canada. Welcome, Dr. Sakat. Welcome.
Thank you.
Hello. Good evening. Thank you very much, Dr. Sharma. It has been a great pleasure to be on this platform. And the series of erudite presentations that we went through actually enriched me a lot. I learned a lot from all the professionals. Thanks to all of them. I'm going to talk, I'm not a profession and I'm not an Ayurvedic practitioner, but I'm going to talk about mental health from the perspectives of what we see in and around us. Now, the World Health Organization suggests that in the next 20 to 30 years, out of every 5%, one of us is going to suffer from mental anxiety, depression. And we do not need to wait for next 20 or 30 years. Like we may not like to admit, but if we reflect back into our life or we stand naked in front of a mirror, we will be able to see that we are all going through some kind of mental issues. Not a single person on this planet right now is there, unless you are a monk or a very high quality sadhu who has left samsara to take up a different kind of a life. We are going through some kind of issues or problems in our life. Every continent, everywhere. First world countries, second, third world countries, developed, underdeveloped. There is no one, politicians, teachers, professors, there is no profession, including homemakers. We all go through some kind of stress. There was a time when we used to say that policemen or people serving in the army or, in those kind of profession or doctors, they usually go through stress. Now, even 10-year-old kids, 15-year-old kids are talking about mental stress, which indicates that as we have made progress in our social, cultural, and economic life, our life has become complicated. Our life has become so complicated that several issues, which were non-issues maybe 20, 30 years back, is now impacting our life. We have so many gadgets, we have so much of technology that help us to move ahead in life. But at the same time, our mental issues are pulling us back, and this is happening to all of us. Whether we want to accept it or not, that's a different question, because as all the speakers have highlighted, that particularly in a developing country like India, which is conservative orthodox, accepting mental health as a disease or where a mental health needs treatment is a taboo in the society. I have seen my relatives proudly boasting about going to a heart specialist or a blood transfusion specialist or a cancer specialist, that they're going to a doctor. But hardly anyone recognizes or wants to share if he or she is going to a psychiatrist or a counselor or a psychologist. The taboo is so intensive. And this is not the case of India. I have even seen in Western countries people do not want to talk about mental health in spite of very high level of education is because, you know why? Is because when you go to a psychologist, counselor, or a psychiatrist, they maintain a file. This file is supposed to be confidential and it includes all your symptoms, histories, and stuff. But there has been very, very many instances where these files or personal data of the patient has been leaked. And it has impacted their job. It has impacted in them in getting insurances, pension. It has mattered to them in case of getting divorce, or a divorce is being denied or something like that. So it impacts people's life. And although these documents are supposed to be highly confidential, many times it has been available on public domain. And if this happens in highly developed Western countries with very highly reorganized medical system, in India, it is even more vulnerable, where we are not very well accustomed to the profession of documentation and keeping them highly confidential. Only under the order of a court or only under the investigation of a police or the government that particular files can be accessed. Otherwise, it is between the doctor and the patient, and no one else get to know this. This has been the convention internationally, but this has been breached all over the world. So people are afraid to go to a psychiatrist or a psychologist or to a counselor, just thinking that I will be vulnerable. The people will get to know my weak points. People will get to know the soft corners of my mind or what is harming me emotionally, internally. And then if I am exposed, I'll be exploited. Someone may misrepresent me. It may impact my job. I may be misinterpreted by my family members. And you do not need to go very far. For many of these mental issues and cases, the place where we do not get enough support is from our family members. We very easily identify an individual as mad, as lunatic, as unstable. Very, very fast we are in reacting this. But we do not pay attention that this is going to come back and haunt me. Because as we are progressing through this rat race and this complex world, we are sure to face some kind of mental issues. What kind of mental issues? Fight between a husband and a wife, a fight between a supervisor and the person working under him, or a fight between siblings, fight over property, fight over every single thing that you can imagine that impacts and crisscrosses our life and makes our life highly complicated. And we are not ready to face those very simply. We are facing this with hidden agendas, hidden way of looking into things, making it even more complicated than those things are. That's why every one of us are going through some kind of stress. But I believe that it is also our duty to stand by our fellow citizens, our family members, and our people who are in and around us, who are going through this mental stress. And sometimes it is not their fault. If you peep into many of the Indian families, you would see how the daughter-in-law is being abused daily basis on their along with their husband and their family members, because it is the custom of the family members to stay together. There are lots of areas where the mother-in-law and the daughter-in-law do not get into common grounds, and there is abuses where women abuses women. It's very common in India. We always talk about men abusing women. There is way more women abusing women in a country like India. Similarly, there is daughter-in-law causing a lot of stress on the parents of the husband in the same scenario. Crisis between broken relationship, crisis between staffs working together, crisis between a boss and their subordinate staff. Everywhere you look in, there is trauma, there is mental issues, there is complexity that we are facing. Even your children hitting you back. How many parents in India get abused by their children? This is no outsider. This is the person that you have raised to this day. You have put in all your investment, love, and care, and now you are being abused by your son or your daughter on a daily basis. Sometimes even it has been suggested that it is not even safe to stay with your children. Move out of that house has been advised to many people, is because many of our belligerent kids are treating their parents in a way which is unspeakable. We will get countless examples on the YouTubes of hidden videos where parents are being abused by their kids. And these are not adult ones, married ones, even young ones. 18, 19, 20, 21 kids are abusing their parents, abusing their mother, abusing their dad, or parents abusing their kids. All kinds of complex mental issues that we used to call Western issues are our issues now. We just don't want to accept it. That's our own issue or a problem, but it is there. Now, if we look into this complex society, how to help? What can we do to change this situation? It's a very complex part. We cannot do a very big thing as we are not doctors. We are not specialized with these. But at least I suggest that there are symptoms. There are links to someone turning into mental depression and anxiety. We as an individual, whether it's our family member, whether it's not our immediate family member, or a colleague, staff, or your distant family member, please pay attention to them. What are the signs that there is problem? One of the most important signs that I have figured out, and I have learned from books and other stuff, is that when you find an individual who was very cordial or very bubbly, suddenly rounds up and do not communicate. You are not hearing from that person. He or she is not communicating on WhatsApp or Facebook, or not responding to phone calls, or even when you meet that person is no longer that cordial, that warm. He or she is shutting up. He or she is transforming and living into a small island. This is one of the first symptoms of mental issues that is impacting an individual. Please pay attention to those individuals, provide them with the help or the care that they need, or even just talk to them if you can and help them out. Sometimes even just sharing your problems, your mental issues with a close friend can help resolve a number of issues. So first of all, if someone has shut off completely, that's a very important sign for mental agony, mental stress, mental anxiety. Point number 2, if someone is becoming overtly emotional, overreacting, there is a small house party and one individual is overreacting, is either over happy, or it's either misbehaving with others, or he's behaving in a strange way that she has never done that before. That's another very important part, even with your spouse, that you need to pay attention to, that he or she is not behaving very normal way that she used to behave. She is getting increasingly emotional. The other part is where you see that someone is becoming increasingly angry. One individual is not being able to control anger or control his emotion. He's bursting into tears or bursting into anger at a very slight provocation or no provocation at all. That's another sign of mental issues or mental health. Fourth is when someone turns into lying. Like, you can understand by talking to that person that it really makes no sense. He or she just giving blatant lies, blatant causes that has no connection to the society, or talking about experiences that he or she has, which could be spiritual, which could be non-spiritual, but which is very distracted from the society that you are in. If you hear from an individual like that, then that's also a sign. Or if someone is hearing voices, someone is hearing that someone is saying something, or someone is having, violent dreams, or having stress every night in sleeping, all these are symptoms of very high quality stress, and we need to be aware of, not just to be discarding that person, but to be in the side of the individual to help him or her in the best possible way you can. My suggestion is, it is best to do some counseling at your end. If you find one of your family members, your spouse, your girlfriend, boyfriend, friend, colleague, anyone is showing these kind of symptoms, if you are empathetic enough, go ahead, discuss with them in person if you can. Sometimes this is not possible. Then encourage or create an environment in which you can help that person or their family members or their closed ones to take her to a psychiatrist or a psychologist or a counselor for some kind of mental health and support. Many people have this belief that medications that comes, I'm talking about allopathic medications, many people have this feeling that if you have mental issues and challenges, if you are put on medication, some of this will be lifelong, it will damage your life and stuff. So, we have many diseases. Excuse me, we undergo many diseases and many challenges, such as diabetes, kidney-related disorders, blood-related disorders, heart-related disorders, brain-related disorders, nerve-related disorders, where you are on serious lifelong medication. And your life is not jeopardized, where you need medication, where you need serious medication, whether you undergo allopathy, homeopathy, Siddharth, or Unani, whatever medication you are going through, it is for your betterment. Don't stop people once the doctor that you have, or any form of medication traditional or non-traditional that you follow, it is important to get that medical help. You may get a temporary medication, you may get a long-term medication. If your conditions are so serious that you need long-term medication, you will have to go for long-term medication. Diabetes is a lifelong disease. It cannot be cured. It can only be the sugar level be reduced for some instances. For some years, you can be a little bit healthy, following all the parameters, then you get back to your high blood sugar levels and stuff. So
Right, your time.
all your medication does. Sorry, need to finish?
Yes,
Dr. Sharma, do I need to conclude?
Yes.
Yes. So if you are on a lifelong medication, you have to be on that lifelong medication. There is no changes. Finally, I conclude by saying this, that we all have seen the great picture of Sri Krishna riding the chariot of Arjuna during the Mahabharata. If you closely look, you will see there are 4 horses that is driving that chariot. And there needs to be coordination of that 4 horses and the strings that are pulling them by Lord Krishna in carrying that chariot forward to be successful in life. Mahabharata is also a reflection of our own life. And what are those 4 horses that represent? One represents you, that you want the society to look at you. One represents your true inner self. One represents the mask that you are wearing. And one represents the pain you are enduring, but you do not want the world to see that. Remember to keep your chariot on the road and Lord Krishna to hold all the strings and have the horse run in unison. You need to have balance over the emotions. So don't be afraid if your mental health is impacting you. It is a common thing that impacts all of us. We need to all be empathetic towards the individual who is suffering this, because it can happen tomorrow to me. And I don't even know if it has already impacted me. With this, I request everyone to extend their empathy for people suffering from mental health on the World Mental Health. And thank you very much for giving me this opportunity to present on this platform. Thank you.
Thank you, Dr. Sakat. Thank you very much. When you start speaking, really, it's just next to impossible to stop or interrupt you, because your words, contents, and flow, everything is excellent. Everything is excellent.
Thank you, sir. Thank you.
Now, Agnihotri sir, to please conclude. Today, we have to postpone one webinar for tomorrow. World Cotton Day, we have planned to share that, but now time is not there. So it will be injustice to speaker as well as audience to have that webinar. So please, Agnihotri sir, now conclude. Session is open. Please guide me when to stop.
Okay, thank you, sir. Thank you, Professor Kon Sharma ji. Today it has been a very good, very nice, very informative webinar on mental health, as it is the World Mental Health Day. All the respected honorable guest speakers poured full knowledge and also emphasized regarding the importance of mental health, not only in case of any patient, but every individual. A lot has been talked about, and the result is this, that everyone should be honest enough to develop the capacity to be positive for his or her own self, for his or her own life, to be positive, and that will be the strongest tool to keep himself or herself away from the mental disturbance, and will maintain in position to maintain the health. So the idea was given regarding the causes, regarding the associated symptoms or the associated diseases, which ultimately leads to the mental health disturbed. So for the maintenance of mental health, a lot have been talked about in the epics and text. This was the total gist of our today's presenters. Now, since I have been advised and instructed to go for the open discussion session, so now the session is open, and it is hardly, say, 12-13 minutes to start 11. So I would like to say, those who have not added their view and have got some information or ideas or principles to add on, in this connection, I would like to invite persons from that side. So here, I see that our Parmar sir is here very much from Mumbai. Dr. Ramesh Kumar sir, if you can please add on something on today's topic regarding the mental health and its maintenance. Sir, good evening. स्वागत है आपका. Dr. Ramesh V. Parmar sir, नमस्कार.
नमस्कार सर.
नमस्कार जी.
नमस्ते.
कैसे आज के टॉपिक कुछ चर्चा चाहिए आपके में, कुछ उद्बोधन चाहिए आपका. So would you like to say something on today's topic? Because we need some best wishes and your benedictions to all of us, especially it's the mental health which is direly needed as far as its intactness is concerned. We are supposed to keep ourselves cool irrespective of the differences. Lord Krishna not only kept cool but also sent the message for keeping balanced even in the battlefield. So practically to which extent we can proceed or realize ourselves. For that we have to be honest for the maintenance of the mental health. So I would like to have some more words from our distinguished speakers. Kirti is here. All have already gone. I think second are already given. Bharati Bairek is very much with us, and he is a very regular participant in on our this platform. I think to make a or to have a feedback, I may very respectfully invite for a feedback sense to our Dr. Honorable Karthikeyan Natarajan sir. If you can please add on a few words after hearing all the participants with their different views, and means that we must have a clear-cut say status in mind that this is a very important say instinct, and we have to keep our mind cool so that the mental health will remain positive. Yes, please. Namaskar. Karthikeyan sir, namaskar. I think talking about the mental health and not caring for the mental health as it, we are keeping all the persons engaged and busy up to almost 11 p.m. So I think it is on other end it is a contrary to talk about the mental health and not observing for the same. So with all respect, I would like to invite Professor, our revered Guruji, Professor Lakshmikant Dwivedi, just to sum up, just to extend your well wishes and say आशीर्वाद to us all. Professor आदरणीय द्विवेदी जी सर, आपका बहुत बहुत स्वागत है.
नमस्कार सर.
नमस्कार.
सभी विद्वत वृंदों को आज के जो टॉपिक तो युगान रूप अपेक्षित भी था. ये सब आयुर्वेद में जहाँ बात आती है तो अष्टांग हृदय तो कहता है कि सब भूते भी परम यस्मान नास्ति चिंता चिकित्सित है. तो सब पांचभौतिक दोषों से पांचभौतिक शरीर की चिकित्सा करनी है. और जहाँ पे मानसिक भाव की बात आती है तो फिर आपको सत्वावजय पे जाना पड़ेगा. और आज की समस्या जो है वो लोभ मोह काम क्रोध और इस तरह के मानसिक भावों के कारण से जो स्थितियां बनती है उसमें सबसे ज्यादा प्रभावित बच्चे होते हैं. और उन बच्चों के लिए अवसाद की स्थिति बन जाती है और समस्याएं का सामना करते रहते हैं. उनको कोई समझ भी नहीं होती और पेरेंट्स भी अगर ध्यान नहीं दे पाए तो इसके पीछे बहुत सारे कारण भी होते हैं. और लक्षण के रूप में दिखाई देते हुए भी हम लोग इग्नोर करते हैं. और बच्चों में इस तरह के अवसाद को रोका जा सकता है, उन समस्याओं को बिगड़ने से बचाया जा सकता है. और औषधि तो एक हिस्सा मात्र है मानसिक भाव से. जैसा कि अभी चर्चा में अग्निहोत्र का जो चर्चा हुई थी उसमें यदि लेते हैं तो परिवार में घर में एक तरह से प्रतिदिन का जो हवन होता है तो मानसिक और स्वास्थ्य और मन की शुद्धि होती है. अन्न भी जैसा खाएंगे वैसा मन होगा. तो उस तरह से जो ऐसे अग्निहोत्र परिवार होते हैं उसमें बाहर से उस तरह की चीज खाना ज्यादा पसंद नहीं किया जाता. और ऐसे मामलों में जब स्थिति बिगड़ने लगती है और समझ आती है तो साइकोथेरेपी उपचार के लिए मानसिक भावों को काउंसलिंग वगैरह करते हैं, जैसी चर्चा में रहा, तो उसका अवसाद के प्रति जागरूक होकर के और कम कर सकते हैं। किंतु समय पे अगर औषधि दें और क्रम से अगर औषधि नहीं लेंगे, लापरवाह होंगे, तो ये जीवन में चक्रव्यूह बन जाता है। जब स्थिति बिगड़ी तो हमने दवा लेना शुरू कर दिया, इलाज करवाया, और फिर वापस वैसे ही हो गए, तो जीवन भर वो व्याधि जो है अवसाद की, उससे बाहर आना मुश्किल हो जाता है। और फिर रसशास्त्र में तो मन को वायु से तुलना की, और रसश्च मनश्चैव चंचलत्वं स्वभावतः रसोबद्धो मनोबद्धो किम न सिद्ध्यति भूतले। तो मनोनियंत्रण के लिए काफी कुछ है, और जो वायु के नियंत्रण से मन का भी नियंत्रण होता है। और इंद्रियाणाम मनोनाथो मनोनाथस्तु मारुत, ऐसा करके। तो इस तरीके से आज के युग में जो गीता, रामायण, इनका जो अभ्यास करते हैं, या कई बार अवसाद की स्थिति में जो तांत्रिक लोग होते हैं उनके पास भी पहुंच जाते हैं, और वो भी कोई रास्ता बताते हैं। तो जहाँ साइकियाट्रिस्ट की जरूरत है, वहाँ ट्रेडिशनल में इस तरह के जो अनधिकृत हैं चमत्कार करने वाले, उनसे भी सावधान रहने की जरूरत है। इतना ही कह के आप सभी विद्वानों का अभिनंदन और नमस्कार, मैं अपनी वाणी को विराम देता हूँ। धन्यवाद।
बहुत बहुत आभार सर, आपका बहुत बहुत आभार। कहाँ से एकदम आप सब्जेक्ट विशेष कुछ कोई भी विषय हो, आप किस तरीके से इसको पकड़ लेते हैं, और इस क्रम में कि रस शास्त्र में जो मन के लिए आया, वायु से आपने मिलान कराया, कि वायु के से तुलना दी की, नो डाउट, और इसीलिए की गई कि जब मन की बात हम करेंगे तो कहते हैं ना कि अणत्वम चैकत्वम दो गुणों मनुष्य स्मृतो, तो उसको जो फास्टेस्ट एंटिटी माना गया है। अभी सामने बैठे हैं, बात कर रहे हैं, मुंबई पहुंच गया, अमेरिका पहुंच गया, भागा रहता है। तो इसलिए मन के जो अणुत्व और एकत्व का जो इसीलिए बताए गए हैं। और चिंतन विचार मुह्यम ध्येयम संकल्प में यत् किंचित मनसो गयम तत्सवैर्थ संगम। तो ये सब बातें हैं ही मन के, और उस मन में ही हमारा मानसिक स्वास्थ्य को बनाए रखना है। इसलिए उसको मानसिक स्वास्थ्य को बनाए रखने के लिए मनसा वाचा कर्मणा तीनों ही रूप से हमें रुकना पड़ेगा, क्योंकि इस भौतिक जगत में भी रहना है, परिवार और समाज के लड़ाई झगड़े तनाव वो भी सब देखने हैं, वर्कलोड भी देखना है, और साथ साथ फिर मन को शांत करके ईश्वराधीन भी करना है। थोड़ा समर्पण, भले ही वो अग्निहोत्र के द्वारा कहीं भी एक आध मिनट के लिए जो पॉजिटिविटी लाने के लिए करते हैं। इसीलिए मन के मतलब मन प्राइम मिनिस्टर से कम नहीं है, उसको हजारों हजार प्रकार के भाव से गुजरना पड़ता है, फिर भी शांत रहना पड़ता है। तो बहुत बहुत अच्छा लगा, आपके बहुत बहुत आशीर्वाद दर्शन मिले, और ये हमारे लिए बहुत ही खुशी की बात है कि आप सब लोग हमको इतने समय तक जुड़ते भी हैं, और आपके हम लोगों का जो मनोबल बढ़ाते हैं, उसके लिए आपका हृदय से हम कृतज्ञ हैं। बहुत बहुत आपका आभार, सभी लोगों का आभार, और शुभ रात्रि, प्रणाम सभी, नमस्कार।
शुभ रात्रि सर, नमस्कार।
ओट पहुंच शर्मा जी,
नमस्ते।
हरिओम।
हरिओम हरिओम।